Welcome everyone back to this conversation on EB 158, item 22, 23 and 26. We are discussing these items and I give the floor to Brazil.
Chair, Brazil welcomes the reports on strengthening rehabilitation in health systems, economics of health for all, and well-being and health promotion, as well as the outcome of the WHO Commission on Social Connection. Brazil commends the recognition of the link between isolation and digital technologies, and we look forward to further engaging in this discussion. Digital technologies have profoundly reshaped social interaction, changing how work is performed and isolating workers through spatial separation, algorithmic management, and the individualization of employment. In many cases, these technologies have weakened social bonds. Digital transformations, to the extent of their impact on all areas of life, should be regarded as the new determinants of health, and the relationship with loneliness and social isolation should be closely monitored. Thank you.
Thank you. I now give the floor to Belgium, followed by India.
Chair, Belgium fully aligns itself with the statement by Poland on behalf of the EU and its member states. As in all policy areas, also economics for health should be guided by evidence and sound economic theory. Outdated approaches that have proven ineffective should be replaced by scientifically robust solutions. This, in our view, is a key contribution of the proposed strategy. Today, countries across the world are struggling to finance health. Therefore, we support strengthening WHO's work and guidance in this area, ideally under the leadership of a chief economist with a strong public profile. We also encourage continued close collaboration with the panel chaired by Professor Mariana Mazzucato to advance these policy solutions. We also strongly support the proposed work on commercial determinants, including guidance on effective measures such as alcohol taxation. Finally, we thank Finland for their leadership on this important agenda. Thank you.
Thank you. I now give the floor to India, followed by Finland.
Thank you, Chair. The intervention is for agenda item 22, 23, as well as 26. India aligns with the report's emphasis on health system strengthening, effective coverage, and the development of global rehabilitation indicators. Chair, the Government of India has embedded rehabilitation across its various national health programs to ensure continuity of care across the life course. Health services are also linked to disability certification mechanisms, the provision of assistive devices and appliances, and social protection schemes, thereby supporting functional recovery and social inclusion. Chair, India supports a phased and flexible approach to baseline data collection and setting of global targets and encourages WHO to develop operational guidance for disability-inclusive rehabilitation integrated into primary health care. On agenda item 23, India welcomes WHO's emphasis on whole of government and whole of society approaches to advance physical, mental, social and environmental well-being. India supports the call to recognize social connection as public health priority and encourages member states to integrate loneliness and social isolation with existing mental health, primary care and social welfare systems. On agenda item 26, India is committed to progressively increasing public health expenditure. Ayushman.
Thank you, India. I now give the floor to Finland, followed by Mexico.
Chair, Finland aligns itself with the statement delivered by Poland on the behalf of the EU and its member states. We thank Secretariat for the preparatory work and engagement with the member states. The draft strategy for the economics of health for all is part of continuum that runs from the Pact for the Future, recognizing how better well-being and its drivers are not only beneficial for well-being and resilience of the societies, but also contribute to sustainable economic prosperity that extends to future generations. In Finland, the Parliamentary Committee for the Future emphasized the importance of safeguarding the well-being of the future generations. The strategy provides us concrete proposals to advance this goal. Social participation and meaningful engagement of communities are essential for successful implementation of the strategy. Thank you.
Thank you. It's been brought to my attention there are two other constituency statements. My intention, so that they can become ready, is that I will take another 3 member state interventions. I'll go to the first constituency, another 3 member states, and then go to the constituencies. And I'll now go to Spain as an EB member who's asked for the floor. So Spain, followed by Mexico.
Thank you very much. Thank you very much. To the Chair, dear Director General, dear members of the Executive Board, and dear colleagues from other delegations. Spain aligns itself with the statement made by the European Union and its member states regarding the economic aspects of health for all. On behalf of our Spanish delegation, we would like to express our sincere gratitude to the Director General as well as to the Secretariat for the comprehensive report and the visionary draft strategy on the economics of health for all. We would like to commend the Council as well as all of its staff in having developing a document that is intellectually robust as well as operationally necessary in this current global context. For too long, health has been treated as a secondary sector or just an additional burden to national budgets. We do think that it is fundamental to work towards a new paradigm in which health is at the heart of decision-making. This draft strategy represents an important step forward to recognize that health is not just an expense that has to be limited, but rather a fundamental investment that can promote sustainable and resilient development, as is established in the approach Health in All Policies, HIAP. Intersectoral cooperation is the only viable way forward to address all social determinants and commercial determinants of health. We completely agree with the fundamental principles that guide this strategy, in particular the emphasis on equity, social participation, as well as the conception of policies that are evidence-based. The 5 strategic areas that have been identified that go from the reorientation of economic policies towards to the strengthening of institutional capacities and increase in funding is an necessary framework for systemic change. We particularly value the focus in creating ecosystems of innovation that prioritize public interest. To conclude, we think that the adoption of the strategy would catalyze concrete advances towards our common objective of UHC. We reiterate our gratitude to the significant efforts provided by the Secretariat, and we hope to be able to work collectively with all countries on this project. Thank you.
Floor to Mexico, followed by Indonesia.
Gracias, Presidente.
Thank you very much, Mr. Chair. Now, on item 23, Mexico would like to reiterate that we need a pan-governmental focus as well as focus of health in all policies with operational approaches that allows us to translate this framework into our country policies. It is key to reinforce the leadership of ministries for health through technical capacity building, training, as well as quality criteria. Mexico believes that we need to prioritize interoperable data systems, health indicators that go beyond GDP, as well as digital tools such as telehealth to reduce inequalities. Likewise, we recognize the social ties as a social determinant for health, and we support its cross-cutting implementation as well as a global indicator that would strengthen evidence-based decision-making. Thank you.
Thank you very much. I now turn to Indonesia. Indonesia will come back to you when you're here. That means I might go to the constituency NCD Alliance. You have the floor.
Thank you, Chair. This statement is coordinated by the NCD Alliance and supported by Worldwide Hospice Palliative Care Alliance, World Stroke Organization, Alzheimer's Disease International, PASS, World Heart Federation, World Cancer Research Fund International, International Society on Thrombosis and Hemostasis, International Society for Biomedical Research on Alcohol, International Alliance of Patients Organizations, Union for International Cancer Control, International Diabetes Federation, Global Alliance for Tobacco Control, UMATEM, and Vital Strategies. Distinguished delegates, we welcome WHO's strategy on the economics of health for all. This strategy rightly positions health as a foundational investment for social and economic development, challenging the persistent framing of health as a cost. This is critical for non-communicable diseases, which drive catastrophic health spending and are projected to cost the global economy $47 trillion between 2010 and 2030, despite the availability of proven cost-effective intervention for their prevention, treatment, and care. We commend its emphasis on policy coherence, good governance, and accountability across sectors. Its call for new multidimensional measures of development beyond GDP and its recommendations for WHO. However, it does not yet sufficiently address the influence of commercial determinants on policy. A clearer distinction between public and private economic interest is needed, alongside explicit safeguards to prevent undue influence and the externalization of costs by health-harming industries. We urge Member States to support the strategy and recommend refinements to position development of health taxonomy beyond private investment to support coordinated action and resource alignments, promote cross-sectoral budgeting that reflects health impact and the economic value of prevention and early management, foster fiscal policy coherence, including through subsidy reforms, elaborates on trade and health, recognizing risk of poorly designed trade liberalization and differing health system capacities, utilize market dynamics for health products and related services, emphasize fair, transparent pricing and tools such as pool procurement, reference WHO and CD best buys as priority investments, explicitly recognize the need of small island developing states, and clarify alignment with other major global health and development agenda. Thank you.
Thank you. I now give the floor to Singapore, followed by Palestine.
Thank you, Chair. Singapore appreciates the reports on rehabilitation, well-being, the WHO Commission on Social Connection, and the economics of health for all. With aging populations, demand for rehabilitation grows. Access is insufficient if care is fragmented. Singapore advances a system-wide approach through our National One Rehabilitation Framework, aligning rehabilitation practices across acute, community, and primary care, with common outcome measures and data sharing for care community. For global indicators, we advocate a phased measurement approach, prioritizing robust baseline data and feasible indicators for coverage and functional outcomes. We strongly support integrating well-being into public health. Social connection is vital, especially for seniors. Our Age Well Singapore program supports active aging and social connection through expanded active aging centres. We support WHO's proposal for Global Social Connection Index and welcome guidelines to reduce isolation. Further details are in our written statement. Thank you.
Thank you. I give the floor to Palestine.
Thank you, Chair. Strengthening rehabilitation in Palestine health system requires a targeted approach that reflects the unique man-made, horrific, complex humanitarian settings, reviewing health challenges that we are facing in Palestine, and looking at the specific rehabilitation needs resulting from the Israeli military operation, like the related injuries and permanent disabilities. Telehealth and digital solutions to provide rehabilitation services, especially in isolated areas, resulted from the Israeli military operation, wanton destruction, and imposed restrictions of movement. Teletherapy session can help patients receive care from remote locations. Understanding the trauma and psychological impact, train rehabilitation providers in trauma-informed care principles to address the psychological and emotional impact of conflict-related trauma on patients, and integrating mental health support into rehabilitation services to address the holistic needs of patients, recognizing the interconnectedness of physical and mental health. Partnership and close collaboration can help reduce economic disparities and ensure equity and health for all. I thank you.
Thank you very much. I give the floor to Zambia, and then we'll have a constituent statement.
Thank you, Chair. On agenda item 22, Zambia has committed to improving the provision of infrastructure and expansion of rehabilitation services at all levels of care. In this regard, we support the immediate launch of baseline data collection in 2026 and request the fast tracking of global tools for rehabilitation at primary healthcare level, service standards, and workforce competencies. Regarding agenda item 23, Zambia continues to demonstrate its strong commitment to global efforts to promote quality health and well-being, and agrees that a broad set of indicators is required to measure health and well-being that would complement the conventional gross domestic product metrics. We therefore look forward to the briefing note of the expert advisory group. With respect to agenda item 26, Zambia emphasizes that the implementation of any initiative related to health economics for all should be conducted in line with national priorities and aligned to regional and national initiatives to avoid fragmentation. I thank you.
Thank you. I now go to the International Council of Nurses. You have the floor.
Thank you, Chair. This statement is for agenda item 26. This statement is co-signed by the following non-state actors: FDI, the World Dental Federation; FIP, International Pharmaceutical Federation; ICN, the International Council of Nurses; WMA, World Medical Association; World Confederation of Physical Therapy, World Physiotherapy; HUMATEM; WONCA, World Organization of Family Doctors; IFBLS, International Federation of Biomedical Laboratory Science; IFA, International Federation on Aging; IPPNW, International Physicians for the Prevention of Nuclear War; Task Force for Global Health. 5 of the organizations supporting this statement, FDI, FIP, ICN, WMA, and World Physiotherapy, are part of the World Health Professions Alliance, representing 47 million health professionals, and have a memorandum of understanding with WHO. An economy of health for all is impossible without sustained and strategic investment in the people who deliver health. There is no economic prosperity without population health, and no population health without a skilled, supported, protected, and adequately resourced health workforce. Health workforce is an essential pillar of sustainable and effective healthcare systems, especially in the light of accelerating population aging. The need for access to healthcare services will increase. Addressing the global health workforce crisis requires long-term, sustainable strategies that prioritize workforce well-being as a core system investment. The health and well-being of health personnel directly influence the quality of care, patient safety, and economic productivity. Neglect leads to higher turnover, absenteeism, preventable errors, or unavailability of medical devices, imposing significant and recurring costs on national economies. In contrast, investing in workforce well-being and education improves care and quality and safety, strengthens retention, enhances system resilience, and delivers substantial economic returns. The economic evidence is clear. Every dollar invested in health systems generates returns of $2 to $4 US. Higher health workforce density is associated with longer life expectancy, improved productivity, and sustained economic growth. Health innovation and macroeconomic strategies must prioritize public health value, equity, and population needs, strengthening primary healthcare and workforce capacity globally. Thank you.
Thank you. I now give the floor to Costa Rica, followed by Ethiopia.
¿Qué tantas capacidades?
Ministries of health have many different capacities. There are, for example, investment in health, sustainable financing, fiscal policies. There is something that is a priority. We really need to make sure that we have the resources necessary. We need to have inclusive technical language in health. The burden of illnesses and treatments that are out-of-pocket payments are one of the budgetary investments which requires more resources. We need to find global strategies. And the healthcare cost must be more effective. There should be concrete proposals to be able to face the challenges to do with the population aging, the increase in chronic diseases, as well as the pressure on public funding. Transparency as well as traceability of resources has to be something that we are working on constantly, and a good practice that is always implemented. Countries that depend on international cooperation to maintain their programs have to continue, but they also need to try to include new approaches in their policies. We need to make an appeal to make sure that there is the assistance necessary, but to have own tools and approaches in each country for them to be sustainable. Thank you.
Thank you. I give the floor to Ethiopia, followed by Oman.
Thank you, Mr. Chair. Ethiopia welcomes the report on strengthening rehabilitation in health systems. We support the proposal on baseline data collection and recommend that this be done leveraging existing health information infrastructures and in a phased implementation approach. We request WHO and partners to also support capacity building and facilitate learning among countries with successful rehabilitation data systems. Chair, we are concerned about the delay in the publication of the first global status report, considering the need to keep the momentum under Resolution WHA 76.6. We propose to have a clear timeline for the global status report instead of indefinite postponement. We encourage WHO to explore alternative ways for resource mobilization and leverage in-country institutional capacities on rehabilitation. On agenda item 26, Ethiopia welcomes the draft strategy on the economics of health for all. We find the vision and transformative approach as timely and relevant. The proposed policy reforms require robust advocacy and cross-sectoral collaboration. We therefore call on WHO to scale up its support to countries to implement the strategy. I thank you.
Thank you. I give the floor to Oman, followed by Kuwait.
Mr. Chairperson, the Sultanate of Oman values WHO's and Resolution 1377 of 2024 with regards to the economic policies for all, and we would like to thank and appreciate the Director General for the two reports issued on this topic, because they include a balanced analysis that supports this policy, and the Sultanate of Oman emphasizes that health economics for all should take into consideration all other considerations and develop an environment and a digital infrastructure that supports such economics of health for all. This policy also supports this notion by reducing costs that have to do with health. And finally, the Sultanate of Oman emphasizes its support to accept the measure with regards to the draft strategy of the health economics for all and to provide provisional reports. Thank you, Mr. Chairperson.
Thank you very much. I now give the floor to Kuwait, followed by Namibia.
During this statement on behalf of the 22 countries of the Eastern Mediterranean region, including the State of Palestine. In the Eastern Mediterranean region, many countries face social, political, and economic instability that affect health and well-being of their population. A paradigm shift is needed to a well-being approach that tackles issues such as health equity, food security, social protection, and digital access. Furthermore, community engagement in health promotion will help build capacity and make communities more resilient during emergencies. A new regional roadmap will guide member states in this work. The report of the Director General on the outcome of the WHO Commission on Social Connection emphasizes it's important for health and the resilience of individuals and societies. Loneliness and social isolation are risk factors for early death, cardiovascular diseases, diabetes, and mental illness. These findings are critical for the Eastern Mediterranean region, given its unique challenges. Strengthening social connection helps to build community resilience, support the mental health of population in a humanitarian setting, and accelerate progress toward health equity and the SDGs. The Commission's work provides a framework for action that includes multi-sectorial collaboration to address the social determinant of health and social connection. A global social connection index would standardize measurement, enabling countries to track progress and identify the most vulnerable population for targeted and evidence-based intervention. I thank you, Chair.
Thank you. I call Namibia, followed by Senegal.
Thank you, Chair. Namibia aligned with the Africa Region Statement and thank the DG for the report on Agenda Item 26. Over half the world still lack essential health services and many face catastrophic health costs. Inequality, vulnerability, especially among children, adolescent girls and women in developing countries burdened by debt, remain a serious concern as this cripples economy, constraining them and their ability to invest in health, PAC, UHC, and the social determinants of health. This is a pivotal moment to strengthen the global health architecture by putting the economy of health as a center of the discussion. and the WHO central role in global health reform, chair the UNAT initiative, and related negotiation present a golden opportunity to advocate for equitable debt restructuring, particularly as we implement the Strategic Direction 3 in this strategy. I thank you, Chair.
Thank you. I give the floor to Senegal, followed by Nigeria.
Je vous remercie, Monsieur le
Thank you, Chair. On item 26, we align ourselves with the statement made on behalf of the Afro region. Senegal fully endorses the DG's vision of health as a fundamental right and also a strategic investment that can bring to bear considerable social and economic added value. This fully chimes with our national transformation agenda that places human capital, social equity and prevention at the heart of our development between now and the year 2050. We are also committed to making health a pillar of our society, structuring our framework expenditures in the midterm, guiding the way in which we spend resources on strong social added value, especially primary health care, promotion of health, prevention of disease, protection of populations against financial risks caused by illness. We are convinced that health is strategic investment in shared prosperity. We therefore reaffirm our commitment to working with WHO and all member states in order to make the health economy for all a real, concrete, inclusive and measurable reality. Thank you.
Thank you very much. I give the floor to Nigeria, followed by Germany.
Thank you, Chair. With the regional statement and commend WHO for the significant progress made in defining effective coverage of rehabilitation, identifying tracer conditions and developing a coherent set of global rehabilitation indicators. In the context of the evaluation process, the focus should be on the area that yield the greatest impact, including strengthening national capacity for rehabilitation data, supporting integration of rehabilitation into primary health care, expanding and equitably distributing rehabilitation workforce, enhancing emergency preparedness for rehabilitation. On the first global status report, Nigeria opines at a delay that allows for more complete and reliable data will ultimately strengthen the credibility and usefulness of the global monitoring framework. We encourage the Secretariat to use this additional time to deepen member state engagement and refine the tools needed for effective reporting. Nigeria underscores the need for high-level coordination mechanisms that bring together health, education, environment, finance, and social protection centers, integrating well-being indicators into national planning for essential tracking. I thank you, Chair.
Thank you very much. I now give the floor to Germany, followed by Indonesia.
Thank you, Chair. Dear colleagues, Germany aligns with the EU statement. With regards to item 26, economics of health for all, we welcome the draft strategy. We see merit in strengthening policy coherence and in better integrating health considerations into relevant public policies. At the same time, Germany attaches importance to a clear delineation of roles and responsibilities in line with national fiscal and budgetary policies. WHO's contribution is most effective when focused on its core mandate, especially normative guidance. Regarding item 23 on social connection, we should prioritize 3 actions at the global level. First, develop evidence-based policy recommendations on causes and consequences. Second, establish standardized international measures and clear guidelines for effective interventions. And third, strengthen multi-sectoral approaches. Thank you.
Thank you. I give the floor to Indonesia, followed by Uruguay.
Thank you. Chair, we support the shift toward well-being as a whole of government and whole of society approach beyond narrow economic indicators. This requires us placing well-being at the center of governance with clear leadership, cross-ministerial coordination and accountability for determinants that sit outside the health sector. Health Ministry could act as a convener while well-being objectives are embedded in national planning, monitoring, and financing frameworks. We take note of the draft strategy on economics of health for all. We see this as a timely approach to position health and well-being as both an outcome and a driver of economic policy. Health should be treated as an economic investment that strengthens productivity, resilience, and inclusive growth. For impact, economic policy for health should be anchored in medium-term development plans and fiscal frameworks and focus on high-return priorities, including primary health care, maternal and child health, nutrition, supported by sustainable domestic financing and coherent whole-of-government action. Thank you.
Thank you. I'll give the floor to Uruguay, followed by China.
Thank you very much, Mr. Chair. Uruguay supports the activities of the WHO, and we have to say that since 2019 we have been working on the integration planning of rehabilitation in health system. This is an essential component of primary health care, as well as UHC. In line with this, we have advanced on the diagnostics of the national situation. We have a rehabilitation plan that we have adopted, as well as an interinstitutional plan that will be implemented. We value this report in putting forward physical health and exercise as a vehicle to fight against NCDs. We have guides in primary health care. We recognize that being sedentary amongst adolescents is a real challenge. We would also like to underscore economics of health for all, that sees economics as an instrument for the benefit of well-being, and we have had a lot of different policies oriented at all in our country. Thank you.
To China.
Chair, China commends the WHO for promoting health and well-being. We note the draft strategy on the economics of health for all and look forward to WHO's role in systematically enhancing the technical support provided by the economics of health for all to government decision-making. We support the draft resolution on radiation and health by Iraq and Egypt. We must point out China remains resolutely opposed to Japan's insistence on discharging contaminated waters from Fukushima into the sea. The release of radionuclides into the sea creates cumulative effects, posing uncertain impacts on human health and the marine environment. We urge Japan to earnestly fulfill its commitment, ensuring that the discharge remains under international monitoring and continues to undergo independent sampling and monitoring. Meanwhile, China supports the WHO in further strengthening research and monitoring of radiation-related health outcomes, as well as enhancing global coordination in the field of radiation and health. Thank you.
Thank you, China. I see there are no other delegations at this point seeking the call. We now have a number of non-state actors who wish to make statements. I will start with the Fédération Handicap Internationale. You have the floor.
Distinguished delegates, Handicap International Federation, with support of the World Rehabilitation Alliance, affirms that the adoption of the 2023 Rehabilitation Resolution marked a historic milestone. Since 2017, over 80 countries have taken steps to strengthen rehabilitation, including the development of national strategies and regional frameworks. However, recent funding cuts and reduced engagement now threaten this progress, particularly in low and middle-income countries and crisis-affected settings. We urge Member States to uphold their commitments through sustained political engagement, targeted financing, and timely reporting to WHO. We also call for a confirmed timeline for the Global Rehabilitation Status Report, which is critical to guide implementation and accountability. The 2.6 billion people who need rehabilitation cannot be left behind. We stand ready to collaborate with WHO and Member States, ensuring rehabilitation remains visible, prioritized, and resourced. Thank you.
Thank you. World Stroke Organisation, you have the floor.
Thank you, Chair. The World Stroke Organization welcomes the focus on strengthening rehabilitation and health systems. Stroke is the third leading cause of disability worldwide, responsible for 145 million disability-adjusted life years, with the burden projected to rise by 31% by 2050. Recovery from stroke is closely linked to timely, high-quality rehabilitation, including mobility, speech and language, and vision services. Despite this, 20 to 40 of healthcare settings globally have yet to implement basic stroke rehabilitation services, with access particularly limited in LMICs. Ensuring access to rehabilitation as part of universal health coverage enables economic participation for survivors and caregivers and reduces the social and economic burden of stroke. We encourage Member States to ensure rehabilitation services reflect the scale of stroke burden and the needs of stroke survivors. Thank you.
Thank you. The Cochrane Collaboration, you have the floor.
Cochrane Rehabilitation, with the support of the World Rehabilitation Alliance, welcomes the Director General report and its recognition of functioning, disability and participation as central to health. While high-risk groups, such as persons with disabilities, older adults and those with chronic conditions are acknowledged, rehabilitation is not sufficiently identified as a health system response to social disconnection. For many, loneliness and isolation are not only social issues, but consequences of unmet rehabilitation need. Evidence shows rehabilitation support mobility, communication, and participation, key to inclusion and well-being. We urge WHO to explicitly integrate rehabilitation into implementation efforts, particularly through primary health care and universal health coverage. With the support of the World Rehabilitation Alliance, we stand ready to collaborate with WHO and Member States to embed rehabilitation within the social connection agenda. Many thanks.
Thank you. Alliance for Health Promotion, you have the floor.
Thank you, Chair. The Alliance for Health Promotion welcomes the continued attention to health promotion as a foundation for universal health coverage, health equity, and the SDGs. 4 decades after the Ottawa Charter, enabling people and communities to take control over their health remains one of the most cost-effective and sustainable investments governments can make, especially in the face of rising NCDs and widening inequities. Yet, health promotion remains under-resourced and insufficiently embedded across health systems and wider policies. CSOs therefore propose exploring a global health treaty grounded in the right to health. Such an approach could help translate global commitments into community-level action through health literacy, community engagement, and action on the determinants of health. We call on member states and WHO to consider initiating a clear process to advance this discussion. Thank you.
Thank you. International Pharmaceutical Students Federation, you have the floor.
Honourable Chair, distinguished delegates, the International Pharmaceutical Students Federation, IPSF, bringing together over 140 member organizations and the Alliance for Health Promotion, A4HP, with 45 member organizations globally, together constitute a critical part of the present and future health workforce. We echo the call for a whole-of-government and whole-of-society approach, and insist that this must equally be a whole-of-profession approach that fully mobilizes pharmacists and pharmacy students in health promotion. For decades, IPSF and A4HP have linked youth and professionals to sustain a continuous chain of health promotion, from addressing macro-level determinants to driving concrete action in communities. IPSF, as digital natives, reach over 800,000 views per month across social media and is ready to leverage this visibility to advance health and well-being for all, working closely with the WHO and its member states. Thank you.
Thank you. Mavendi International, you have the floor.
Thank you, Chair. Across the Secretariat's report on well-being and health promotion, as well as the Social Connection Commission's flagship report, alcohol is treated as peripheral rather than as a structural determinant of mental health, NCDs, and social isolation. Alcohol is framed mainly as an individual coping response to loneliness, while the role of alcohol products and alcohol industry practices in driving harm and social disconnection is absent. We call for explicit recognition of alcohol as a cross-cutting, preventable risk factor interacting with loneliness across the life course. We call for WHO to integrate SAFER into social connection guidance, include alcohol indicators in measurement frameworks, and center social participation. Civil society organizations, including Muvendi members, already strengthen social connection through prevention, recovery, and family support, delivering health promotion and social connection together. Thank you.
Thank you. Knowledge Ecology International, you have the floor.
If health for all is to be more than an empty slogan, health authorities need to design policies that make universal access feasible. Unequal access to new medicines is an appalling fact, but it's fixable. Feasible and compelling policy changes can dramatically improve equity. Products are typically very cheap to manufacture, but access-blocking prices are propped up by legal monopolies. Redesigning incentives to invest in R&D so rewards are delinked from legal monopolies and high prices is possible, but only if policymakers do the analysis to determine the appropriate size of market entry rewards and provide a plan for the progressive implementation of the new business model. Thank you, Chair.
Thank you. Drugs for Neglected Diseases Initiative, you have the floor.
Thank you, Chair. Market-driven R&D cannot address the needs of many marginalized communities, leaving innovation gaps for diseases with little commercial return, such as NTDs. Governments play a critical role in ensuring public investments in health innovation deliver public value. DNDi supports directing innovation, particularly publicly funded innovation, towards public health priorities. Conditions on public funding of innovation could help ensure the development of and equitable access to health technologies. We urge member states to implement Article 9.5 of the Pandemic Agreement by establishing policies on conditions for publicly funded research. We also emphasize the need for policies that embed equity and affordability into the innovation process from the start, including in priority setting, partnership models, open science, pro-access licensing, and technology transfer. Thank you.
Thank you. Medical Women's International Association, you have the floor.
Thank you, Chair. Medical Women's International Association welcomes the draft strategy and its commitment to equity and gender equality under the economics of health for all. Achieving health for all requires deliberate prioritization of women facing the greatest barriers. However, till today, 66% of the poorest women still lack access to universal health coverage due to financial constraints, and 20% of the poorest women require permission from their partners or family members to seek treatment. Globally, women represent 70% of the global health workforce, yet hold only 25% of leadership positions. Centering the most vulnerable women and female health professionals is essential to realizing health for all. Thank you.
Thank you. Save the Children Fund, you have the floor.
Thank you, Chair. Good afternoon. Save the Children welcomes the draft Economics of Health for All strategy amid stagnating health spending, widening UHC gaps, and sharply reduced ODA. Framing health as a public investment is critical, but the strategy must clearly specify equity trade-offs that may arise if health is approached solely through an economic lens. Vulnerable population, including children in hard-to-reach areas, must be prioritized through targeted investments that yield high-return human capitals, ensuring leaving no one behind. As per the Social Participation Resolution, closely involving civil society as well as aligning with the Lusaka Agenda principles will ensure predictable, equity-driven financing, building momentum towards the UHC high-level meeting in 2027. Thank you very much, Mr. Chair.
Thank you. International Federation of Medical Students Associations, you have the floor.
Esteemed delegates and honourable chairperson, we commend the WHO for the 2 reports under this agenda item. We affirm that there is no well-being without social connection. Today's youth are among the most digitally connected, yet increasingly socially disconnected, driving poor mental health outcomes, stigma, and reduced access to appropriate care. Social disconnection is not only structural, it is functional. Systemic inequities, discrimination, and fragmented systems deepen isolation rather than foster inclusion. Addressing this requires deliberate, equity-centered policy actions, and hence, IFMSA calls on member states to integrate national strategies for social connection across health, education, and social sectors, and the WHO Secretariat to develop robust metrics to track progress in social connection and continue building well-being societies. Investing in social connection is not optional. It is the foundation of resilient, interconnected health systems, allowing sustainable well-being of people and the planet. Thank you.
Thank you. Public Services International, you have the floor.
We find the draft strategy inadequate for achieving transformative action centering health in economic decision-making. Health is more than wealth. It is the most foundational of fundamental rights. Health for all can only come out of a political choice to structurally reform the global political economy, decommodify healthcare, curtail corporate power, and unambiguously put people and the planet over profit. The work of the Council gave a toehold that's now been smoothed. The problem is not lack of wealth. Health and social inequalities are interlinked. This is systemic. Member states can make a difference. You can push back. Generations to come will ask what you did at this hour to make the world a better place where people's health and not the super wealth of a few is what really counts. Thank you, Chair.
Thank you. I see there are no more requests from the floor. I shall ask the Secretariat to respond to any questions that have been raised during the debate. I will start with RD Amro, and then we'll hear from RD Afro, and I think Dr. Farrow will also comment. So RD Amro, you have the floor.
Thank you, Chair. I believe these remarks on behalf of the regional directors. I want to commend WHO Commission on Social Connection for bringing renewed attention to an issue that is increasingly shaping health and well-being across societies. The Commission report reminds us that social connection is not only about individual relationships. It's also about the wider conditions that enable people to participate, interact, and feel part of their communities. These conditions are shaped by public policies, how environments and services are organized, and how people are enabled to engage in social life. This valuable report also highlights the close relationship between social connections and mental health. Social isolation and loneliness can increase vulnerability, while supportive social environments help strengthen resilience and protect well-being, particularly in the context of aging populations and longer life expectancy. WHO's response to the Commission's findings is reflected in three complementary areas of action. First, prevent social isolation by strengthening social participation and community engagement. Policies that promote participation and inclusion are essential to sustaining social cohesion and improving health outcomes across the life course. Second, addressing loneliness and social disconnection requires coordinated action beyond the health sector. Intersectoral approaches across areas such as urban planning, transport, education, housing, and social protection are critical to create environments that support social connection. Third, responding to the health and social consequences of loneliness is a public health priority. Strengthening social networks and supportive relationships is increasingly integrated to broader multi-sectoral responses, including mental health and suicide prevention efforts. Chair, the Commission report also makes clear that translating evidence into action will depend on sustainable political leadership and stewardship. WHO stands ready to support this work in the future. Thank you.
Thank you. I give the floor to RD Afro.
Chair, Excellencies, distinguished guests, for Africa and the world at large, the economics of health for all is not a theory, it is a survival. Every day, families are pushed towards poverty, selling what little they have, pulling children out of school, delaying life-saving care, not because the services don't exist, but because health is becoming unaffordable. This is not the future any region was meant for. It is the consequences of economic models that advance while health systems were left behind. Africa knows a simple truth: health is wealth, and the primary health care drives economic strength. Yet, debt servicing, climate shocks, and shrinking physical space are choking choices in Africa and globally. Health is not a privilege. It's a national and global responsibility. Poverty must not be inherited. As we say in Africa, when spider webs unite, they can tie up a lion. The choice is clear. Either economies protect life, or they decide whose life is worth protecting. Choose people, choose equity, because a nation's true wealth is its health. Let us not recycle poverty. WHO stands ready to walk this path with you. Thank you. Merci. Obrigado.
Thank you very much. And finally, I'll turn to ADG of PPC, Jeremy.
Thanks very much, Chair. And following on from those comments from the two regional directors, and thank everybody for the very strong support for these three items we've been discussing, and also very strong support for the WHO to take a very strong scientific methods approach to all of the work within these and all other items that we will be discussing. Just some common themes to pick out. I think the discussions today and the ones I was involved in earlier in the week just showed just how much convergence actually there is going on in global health. The issues that are being debated are common to everybody, whether it be coming rapid social change, demographic shifts, the rise in non-communicable diseases, but the continued threat and impact of infectious diseases, inequality, migration, movement of people, all of which is more complicated when you start to have to deal with long-term conditions which require consistent support. Everybody within the public health community around the world would agree that health is an investment in the future. Not necessarily everybody in other sectors would agree with that, particularly when financial constraints are pushing countries into difficult trade-offs. It's our responsibility to reach out beyond our sector and make the case that health is an investment for health and well-being, but also for economic growth and productivity. It's our responsibility to reach out beyond our sector and make sure it's not just ourselves talking to ourselves. It is a whole-of-government approach, as everybody has said, and that's also true. It's a whole-of-WHO approach, which is why having two regional directors make their comments is so important. But it's also the strategic prioritisation and reforms of 2025 that led us to the WHO of 2026 by integrating and bringing things together in a way that perhaps wasn't quite so clear in the past, both in headquarters, regional offices, and in country offices. Two other comments to make. One is the alignment with the UN system. We've mentioned UN80 many times, but also the opportunity we have to leverage WHO collaborating centres and the WHO Collaborating Centre Network meeting, which will happen in Lyon in April of 2026. Finally, two comments. Take the point on the low back pain being a reasonable indicator to start with, but that there are more complex issues to take on, and we will do that in partnership with those that brought that up. And lastly, on economics for health for all, we would welcome further additional comments to be made between now and WHA, and if the Member States wish, we will organise consultations in the intersessional period. Thank you.
Thank you very much. As I see no more requests for the floor, may I take it that the board is ready to note the reports contained in documents EB 158/26, EB 158/27, and EB 158/28. I see no objection. The reports are noted. Let us now consider the draft decision contained in document EB 158/31. Is the board ready to adopt the draft decision provided in paragraph 7 of the document EB 158/31? I see no objection. The decision is therefore adopted. Thank you. Let us now consider the draft resolution contained in document EB 158/1/1. Is the board ready to adopt the draft decision contained in EB 158/conf/1 on radiation and health, strengthening global protection, preparedness and responses? I see no objection. The decision is therefore adopted. Thank you. This concludes the board's consideration of items 22, 23 and 26. Let us turn. This concludes the board's consideration of items 22, 23 and 26. I note Dr Farrow mentioned there'll be further consultation before WA, and I'm sure they'll be informed shortly as how that will happen. Let us turn to the next item. I close those items. We shall now consider the following grouping of items. Item 24 on the draft Global Plan of Action for the Health of Indigenous Peoples, and item 25 on maternal, infant and young child nutrition. In relation to item 24, the relevant report is contained in document EB 158/29 on draft Global Plan of Action for the Health of Indigenous Peoples. The financial and administrative implications are contained in document EB 158/29 Add 1. The Board is invited to note the report and consider the draft decision to defer consideration of the draft Global Plan of Action for the Health of Indigenous Peoples to the 80th Health Assembly in order to allow additional time for further consultations with Member States, Indigenous peoples, relevant United Nations and multilateral system agencies, civil society organisations, academia and other stakeholders. In relation to item 25, the relevant report is contained in document EB 158/30 on maternal, infant and young child nutrition, comprehensive implementation plan on maternal, infant and young child nutrition. The Board is invited to note the report and to provide guidance on the questions contained in paragraph 25. I will open the floor for discussion. As always, we'll start with EB members. Member States who are not a member of the EB, please, if you could, wait for the call until we've moved through the EB members. I start by giving the floor to the Central African Republic, followed by Lebanon. You have the floor.
Monsieur le Président.
Chair, the Central African Republic is taking the floor on behalf of the 47 member states of the African Group. We commend the progress made by the Secretariat and also the inclusive approach that has been decided upon, an approach based on human rights, gender equality, health equities and respect for indigenous knowledge and practices. Having considered the document, the Africa Group is happy to note 5 priority areas of action that are proposed: the production of evidence, access to available health services that are accessible, acceptable and of high quality, effective participation of Indigenous persons in decision-making, the promotion of intercultural approaches, including traditional medicine, as well as taking into account the effects of climate change, loss of biodiversity, pollution and environmental degradation on their health. The Africa region attaches particular importance to the principle of prior informed consent. This has been identified as being the basis for a future global plan of action in step with the UN Declaration on the Rights of Indigenous Peoples and Resolution WHA 7616. Nonetheless, we share the Secretariat's view as to the need to pursue and increase the depth of consultations, especially in contexts where Indigenous peoples may be in a minority, dispersed or insufficiently documented. That being so, strengthening consultation mechanisms that are tailored to cultural and linguistic realities remains vital to guarantee effective participation. In that context, we note and support the proposal from the DG to postpone by 1 year final consideration of the Global Action Programme in order to allow for additional consultations and to guarantee that the plan will fully reflect the diversity of contexts, priorities and perspectives of Indigenous persons and peoples and member states. In conclusion, we reaffirm our commitment to actively contributing to taking this process forward, and we approve the draft decision as submitted.
I now give the floor to Lebanon, followed by Lesotho.
Mr. Chair, esteemed members of the Board, distinguished colleagues. On behalf of the Member States of the Eastern Mediterranean region, Lebanon welcomes the Director General's report on the draft Global Plan of Action for the Health of Indigenous Peoples. We welcome the overarching principles and 5 priority areas of the plan, which are well aligned with WHO's 14th General Programme of Work and will contribute meaningfully to the improvement of the health of Indigenous peoples. These priorities are highly relevant to the health context of our region and to the challenges faced by the population as a whole and by Indigenous peoples in particular. We look forward to receiving WHO technical support in the development of national plans on advancing, promoting, protecting, and enhancing the physical and mental health of Indigenous peoples, including in health emergencies. We have been invited to participate in a regional member state consultation alongside representatives of Indigenous people, relevant United Nations and multilateral agencies, civil societies, academia, and other stakeholders. We look forward to this consultation and its discussions, which will gather valuable feedback on the draft Global Plan of Action. Thank you.
Thank you. I give the floor to Lesotho, followed by Norway.
Thank you, Chair, DG, distinguished delegates. The Kingdom of Lesotho has the honor to deliver this statement under Agenda 25 on behalf of the member states of the WHO African region. We welcome the discussions on maternal, infant, and young child nutrition and thank the DG for highlighting the continued slow global progress towards global nutrition targets. The African region recognizes important achievements, including improved rate of exclusive breastfeeding and notable progress in nutrition-related policies and legislation, including implementation of the International Code of Marketing of Breast Milk Substitute and healthy diet policies. However, progress remains uneven and insufficient to meet regional and global targets. We remain deeply concerned that the region continues to bear the highest global burden of childhood stunting and anemia among women of reproductive age, with slow progress in reducing low birth weight. While wasting has declined in several countries, significant inequities persist, particularly in fragile and climate vulnerable settings, alongside a rising prevalence of childhood overweight in parts of the region. These challenges are compounded by declining external financing, limited domestic investment, weak multi-sectoral coordination, gaps in regulatory enforcement, and fragmented data systems. The African region therefore calls for sustained and predictable financing for nutrition, stronger integration of nutrition in primary healthcare, universal health coverage, and social protection systems, accelerated scale-up of proven cost-effective interventions to address anemia, stunting, low birth weight, wasting, obesity, and strengthened regulatory and technical measures to address digital marketing of unhealthy foods and breast milk substitutes. We further underscore the need for enhanced WHO support to fragile and climate vulnerable settings, including emergency responsive nutrition services, strengthened surveillance, and multi-sectoral coordination. We reaffirm our commitment to advancing nutrition as a foundation for equity, resilience, and sustainable development. I thank you.
Thank you. I give the floor to Norway, followed by Bulgaria.
Thank you, Chair. On item 24, Norway thanks the Secretariat for its efforts aimed at developing a global action plan on indigenous peoples' health, in which Norway has contributed to the process. Given the WHO's financial situation and the need for further consultation, including by indigenous populations, Norway supports the proposal to postpone the development of the action plan. On item 25, Norway commends WHO for its efforts to promote good nutrition for mothers, infants, and young children. We are concerned about slow progress towards the 2030 target, and we call for stronger action and for all stakeholders to deliver on the Nutrition for Growth commitments and pledges. Implementing the International Code of Marketing of Breast Milk Substitutes is essential to protect breastfeeding and thereby maternal and child health. Government should regulate and monitor digital marketing of breast milk substitutes in line with the Resolution 78.18, which calls for stronger, coordinated regulation and effective monitoring and enforcement. WHO plays a key role by providing guidance and technical support. Government should also address conflicts of interest in healthcare facilities and clarify prohibited sponsorship in line with WHO guidelines. Finally, we are deeply concerned about the recent large-scale recalls of breast milk substitutes. This highlights the importance of food safety and robust monitoring to ensure the safety of breast milk substitutes. Thank you.
Thank you. I now give the floor to Bulgaria, followed by Somalia.
Chair, I have the honor of speaking on behalf of the European Union and its 27 member states.
the candidate countries North Macedonia, Montenegro, Serbia, Albania, Ukraine, Republic of Moldova, and Georgia, as well as Armenia, align themselves with this statement. We thank the Director General for the report and acknowledge the progress towards the global nutrition targets, whilst recognizing the significant challenge faced globally. We are actually far off track in achieving the 6 targets by 2030. Conflict, climate change, poverty, and gender discrimination are some of the major drivers of malnutrition. It is a major cause of illness, health inequalities, and death, particularly among children. We call on Member States to develop and support the delivery of concrete action plans and initiatives to scale up coverage of the process targets agreed in last year's Resolution 78.24. We call for its full implementation, which includes integrating nutrition within health systems and taking key actions, including provision of essential nutrition actions within primary care. Team Europe pledged €6.5 billion at Nutrition for Growth Summit last year to fight global malnutrition up to 2029. Recognizing that every dollar invested in nutrition gives a return of $23, we call on donor countries to scale up their financial investment in nutrition, and for all member states to increase domestic resource mobilization. In addition, we call for prioritization of the most effective and coordinated interventions that can be integrated in health, social protection, education systems, humanitarian response. Food systems, for example, national school meal programs, need to be transformed to improve nutrition and environmental outcomes. We call for increased coordination and support for data collection on nutrition actions and outcomes. Improved use of data, research, and operational evidence will help target the most vulnerable. Maternal, infant, and young child nutrition is crucial to health and survival. Ensuring optimal nutrition during the first 1,000 days of life is essentially crucial and essential for long-term health and economic benefits. We appeal for a renewed commitment to work together across borders and sectors to turn global targets into tangible realities. Additionally, we suggest that the WHO continues to disseminate evidence on the negative impact of digital marketing of breast milk substitutes and continues to technically support the member states in the implementation of the WHO code on that matter. Thank you.
Thank you very much. I now call Somalia, followed by Barbados.
Thank you, Chair. Somalia is delivering this statement under the agenda item of 25 on behalf of the Eastern Mediterranean region. The member states of Eastern Mediterranean region face a complex nutrition burden driven by conflict, displacement, climate shocks, economic pressures, particularly in low-income and emergency countries. Many face the double burden of malnutrition, undernutrition, macronutrient deficiencies, alongside overweight, obesity, and diet-related non-communicable diseases. In 2024, 24.3 million children under 5 in the region were stunted, and 5.9 million suffered from wasting, while 4.2 million were overweight. While stunting and wasting has reduced, and the region is on track to meet the global target for overweight among children under 5, many countries remain off track for global nutrition targets. Efforts to address this focus on essential nutrition services in primary health care, including macronutrient supplementation and growth monitoring, promoting breastfeeding, nutrition counseling, and healthy diet, include reduced salt and sugar intake, and taxation of sugar-sweetened beverages, and promoting elimination of industrially produced trans fat. We welcome WHO's support for high-impact evidence-based nutrition interventions, strengthening multilateral action and targeting nutrition within the health systems. Promoting breastfeeding is critical, including full implementation of International Code of Marketing for breastfeeding substitutes, particularly in fragile and humanitarian settings. We call for prioritized support to fragile and conflict-affected settings to strengthen nutrition surveillance, support the food systems to deliver healthy diets, while safeguarding public health policies from conflicts of interest. Thank you, Chair.
Thank you. I now give the floor to Barbados, followed by Thailand.
Honourable Chair, maternal and child nutrition remains a cornerstone of Barbados' development. While the country has made progress in areas such as food-based dietary guidance, school nutrition standards, and regulatory action to improve food environments, challenges persist across the nutrition life course. These challenges are occurring against a backdrop of a high burden of NCDs, fiscal constraints, and food system vulnerabilities. Barbados has undertaken several policy actions aligned with the Comprehensive Implementation Plan on Maternal, Infant, and Young Child Nutrition. These include the Barbados School Nutrition Policy, as well as fiscal and regulatory measures aimed at reducing exposure to unhealthy food components, such as industrially produced trans fats, sugar-sweetened beverages, and high-salt snacks. Despite these efforts, exclusive breastfeeding rates remain suboptimal and have declined over time, with recent national data indicating rates of approximately 15%, significantly below the global target. We recognize that barriers such as the early return to work and insufficient workplace support are primary drivers of this decline. In response, Barbados is committed to strengthening workplace and social protection policies to create a truly enabling environment for mothers. In alignment with the DG's report and the proposed extension of the implementation plan to 2030, Barbados identifies the following priority actions: strengthening supportive food and nutrition policy environments, integrating evidence-based nutrition interventions into national health and development plans, advancing multi-sectoral action across labor, education, social protection, and food systems, building institutional and human capacity, including revitalizing nutrition surveillance, and enhancing monitoring, evaluation, and reporting to ensure accountability and impact. Finally, Barbados acknowledges the critical technical leadership of the World Health Organization in collaboration with PAHO and other partners in supporting member states to advance this agenda. Thank you.
Thank you. I give the floor to Thailand, followed by Panama.
Thank you, Chair. Regarding maternal, infant, and young child nutrition, Thailand concerns that the global targets remain off track, despite the extended milestone at 2030. Thus, we emphasize two issues. First, a life course approach should prioritize prevention, specifically breastfeeding, protection, and age-appropriate feeding. Second, service delivery must be strengthened across health and non-health settings, such as child development centers, while integrating nutrition supplement into UHC benefit packages. Furthermore, we designate nutrition as a national agenda and urge WHO to support tools like SQL detectors to monitor and restrict harmful online food marketing. On item 24, Thailand stresses that indigenous people health is vital for achieving health equity. We uphold the principle of free, prior, and informed consent and support deferring the draft plan to the 80th WHA to facilitate deeper culturally appropriate dialogues. Thailand remains ready to share its experience in ethnic minority health to contribute to a robust, actionable plan. Thank you, Chair.
Thank you. I now call Panama, followed by Nepal.
Gracias, Presidente. Thank you very much, Mr. Chair. Panama believes that it would be best to have some additional time to be able to carry out inclusive consultations that are focused on analyzing and including the contributions of member states and indigenous peoples to the global plan of action for the health of indigenous peoples. We would like to have a plan that fully reflects the diverse context, priorities, as well as outlooks, and that offers us a very robust basis for its full implementation. At the same time, we would like to express the fact that the plan is aligned with our national laws. We take note of the report and we support the draft decision contained within. We appreciated the report EB 15830 and we recognize the advances that have been reported in the report, as well as the consistent challenges in achieving the global nutrition targets by 2030. We must focus our interventions on cost-effective ones that are focused on high impact activities, especially during the very first 1,000 days of life. The protection, promotion, and support for maternal breastfeeding are the investments that are the most cost-effective that could help improve nutritional results and to reduce the burden of diseases in the future. Territorial planning, the strategic use of data for decision-making, as well as intersectorial coordination with social protection systems, education, and school nutrition systems will help us, even though there are limited resources in these programs. The digital marketing of breast milk substitutes means that we should have normative tools and technological tools to adapt the implementation of the International Code to environmental surroundings and environment. We need to be very aware of improper activities, and we need to make sure that we have protocols and safety systems in place. We reaffirm our commitment to the global targets of nutrition, and we would like to appreciate the technical assistance provided by PAHO and WHO. Breast milk is the best food for breastfeeding babies. Thank you.
Thank you very much. I'll now give the floor to Nepal, followed by Haiti.
Thank you, Chair. I would like to thank the Secretariat for the report under Agenda Item 25. Improving maternal, infant, and young child nutrition is fundamental to achieving universal health coverage and STDs. Malnutrition in all its forms, undernutrition, micronutrient deficiencies, and the rising burden of childhood overweight continues to undermine health, development, and well-being across the generation. Nepal has made steady progress in reducing stunting, improving exclusive breastfeeding rates, and expanding access to essential nutrition interventions. We are scaling up evidence-based programs such as counseling on complementary feeding, maternal diets, anemia prevention, and early childhood development, including through community health workers and female community health volunteers. Nutrition is being more fully integrated into primary health care, and digital tools are being leveraged to enhance service delivery, monitoring, and family-level behavior change support. Yet climate change, food insecurity, and socioeconomic inequities continue to threaten progress. Nepal therefore underscores the need for stronger multi-sectoral action linking health, agriculture, education, social protection, and sanitation to address the root causes of malnutrition. Maternity leave, an increasing number of breastfeeding-friendly workplaces significantly promotes breastfeeding practices among working mothers in Nepal. Nepal calls on the WHO to strengthening country capacity for early prevention and accelerate multi-sectoral action with strategic support for integrating nutrition across food systems, social protection, and climate resilient policies. Further, my delegation also stresses the need to increase awareness regarding the recommendations contained in the WHO's guidance on regulatory measures aimed at restricting digital marketing of breastfeeding substitutes 2023. Nepal remains committed to advancing maternal and child nutrition. Thank you, Chair.
Thank you. I give the floor to Haiti, followed by Costa Rica.
Monsieur le Président. Dear Mr. Chair, Haiti would like to thank the Secretariat for the reports that have been presented on the health of Indigenous peoples as well as maternal, infant, and young child nutrition. These two items recall an essential aspect. Indigenous peoples, just as many other vulnerable communities, continue to face deep inequalities when it comes to access to care, to social determinants that are very difficult, as well as to insufficient recognition of their knowledge and cultural approaches. Guaranteeing accessible services that are culturally appropriate as well as participative is a precondition for health justice. Likewise, maternal, infant, and young child nutrition are essential pillars of human development. Stunting, anemia, low birth weight, or even the increase in youth overweight means that these challenges continue to persist and require intersectoral responses. For Haiti, these priorities require sustainable financing, reinforcement of local capacity building, as well as integrated community approaches. Investing in nutrition and cultural equity and health means to invest in the resilience for future generations. Haiti supports the EB to take note of these reports, and we encourage international cooperation that becomes more robust to make sure that we translate these frameworks into concrete action.
Thank you. I'll now give the floor to Costa Rica, followed by Cameroon.
In
Costa Rica, a part of the main gaps is maternal anemia, which is one of the main challenges, and we do have a low iron as well as a low adherence to supplementary iron. Breastfeeding is improving, but we have not yet achieved the target that has been set forward by the WHO, and women are going back to work early. This is one of the reasons why there is low breastfeeding. We are very concerned with these challenges. Unfortunately, there are ultra-processed diets that are linked to sedentary lifestyles. We require public policies that are strong and accountable. The manufacturing must be aligned with these plans. There are also marketing of products that are harmful for people. Cost is one of the determining factors, the most determining factor for people when it comes to what they are buying. We see that for a lot of people, the unhealthiest products are the cheapest. Regarding the Plan of Action on Indigenous Peoples, we would like to thank you very much for the report that has been presented, as well as the Plan of Action, where there are 5 topics, 5 activities that are very pertinent, but to be able to continue with its implementation, we need to take into account specificities in terms of data, requirements by different countries, and the political and scientific resources that will have to be made available in each country and each region. Therefore, we would like to ask the Secretary to go deeper into this sector and look at what activities will be necessary to implement the plan. Thank you.
Thank you. I give the floor to Cameroon, followed by the Central African Republic.
Monsieur le Président.
Chair, Director General, Cameroon wishes to echo the statement delivered on behalf of the African region. We also wish to commend the Director General on the high quality of the documents before us, and we note progress made when it comes to the health of Indigenous peoples and also when it comes to maternal, infant and young child nutrition. The UN Charter states that health is a universal human right. All human beings have the right to health and the right to a healthy environment. In Cameroon, we have taken an important step recently. We adopted legislation on traditional medicine, and this is something that was promulgated by our head of state. The legislation that has been adopted reflects our resolve to structure this wealth and to take into account local realities and conditions, as well as the needs of Indigenous peoples in doing so. We therefore advocate for the elaboration of regulatory frameworks that promote social equity and fairness and that take into account the health of Indigenous peoples. And we support the draft Global Action Plan on this item. On the issue of maternal, infant and young child health, we know that these are very vulnerable groups, and malnutrition in those areas is really a silent epidemic today in Africa. Despite all that has been done, we still see stunting, anemia, lack of certain nutrients in these groups, and this remains a significant problem. We also note poor coverage when it comes to nutritional interventions in Africa. That is to say, for maternal, infant and young child health, particularly in Indigenous peoples. We therefore call for funding to ensure that at local level, appropriate maternal, infant and young child nutrition can be provided to all. And we need a better match between social protection, education and community integration programs with all that is done for health. We take note of this document and we reaffirm our commitment to supporting the WHO health programs in these areas. Thank you.
Very much. I now give the floor to the Central African Republic, followed by Japan.
Monsieur le Président, la RC...
Thank you. Thank you. The CAR wishes to thank the Director General for this report on maternal, infant and young child nutrition. We certainly endorse the statement made by Region on this area. We are concerned about the aggressive marketing, I would even call savage marketing, for breast milk substitutes. And this is something that is undermining breastfeeding in our countries, particularly for fragile groups. And this is in fact taking advantage of communities that are already poor and fragile. As we see it, we must ensure that there is no way that we can close our eyes to the truth. These kind of products do not replace breast milk, and in a context where access to safe drinking water remains a challenge, this is something that can expose young children and babies to infection. And sometimes, indeed, this is really an issue from the very time when the products are being manufactured. We therefore urge WHO to do more. We call for more to be done in terms of monitoring digital marketing, particularly targeting African countries. We need multi-sectoral cooperation that is cross-boundary in order to tackle this issue. We need to involve public-private partnerships, people from trade and financial sectors. We need all of these people to get together. Certainly in our country, we are seeking right now through a campaign to protect breastfeeding, because that is protecting our future. Thank you.
Thank you very much. I give the floor to Japan, followed by Ukraine.
Thank you, Chair. I recommend the statement on agenda item 25. Japan has been addressing nutrition issues since the late 19th century, beginning with the establishment of the National Institute of Nutrition and the training of nutrition professionals in the nutrition school in the 1920s. The country has been promoting a nutrition policy built on three key pillars: a diet-based approach, human resources, and scientific evidence. In particular, in terms of the human resources, nutrition professionals are placed to various settings, including public health centers, hospitals, and schools under relevant laws, contributing to on-site nutrition improvement throughout the life course. With such experience, Japan believes it is important to work on nutrition improvement through the training of nutrition professionals so that each country can independently advance nutrition policies, including maternal and child nutrition. In particular, in recent years, an increasing number of countries have shown interest in Japan's school nutrition program, school lunches, and food education. And Japan International Cooperation Agencies, JICA, is providing support through the Technical Cooperation Project and training programs in Japan. Japan will continue to support nutrition improvement, drawing Japan's knowledge and experiences. I thank you, Chair.
Thank you very much. I give the floor to Ukraine.
Dear Chair, colleagues, Ukraine thanks the Secretariat for a report of maternal, infant and young child nutrition. It confirms a hard truth. Global progress is off track and gap is widening its crisis settings. Our most relevant priority is delivery with equity. Protection the first 1,000 days through services that still functions under description. That means endemning essential nutrition action into primary health care and maternal and child services with clear pathways for the most valuable reserve for replying or personal projects that collapse when funding strings. At the same time, we face the double burden. Defiance and obscenity can consist. This is why we interest in food environments, not only individual consequences. A key platform is schools. Ukraine has adopted national rules for school meals and scaling up free meals, including expansion for older grades in frontline and border regions. This aligns closely with WHO new guidance on healthy school food nutrition. Finally, we strongly support strengthened implementation of the International Code of Digital Space. WHO has already provided guidance on restriction digital marketing and break milk substances. And countries now need ready-to-use legal and enforced token-conveying influences, target advances, platform responsibilities, scalable monitors, and across-border cooperation. Ukraine stands ready to share lessons learned and calls of WHO to help member states, especially these under pressure, to recommend in practical tools for impact. Thank you.
Thank you. I see no other Executive Board members seeking the call, and therefore I will go to other member states. I give the floor to Chad, followed by Burundi.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Chair. Chad aligns itself with the African regional statement that has been prepared by Lesotho, and we would like to thank the Secretariat for the quality of the reports that have been presented. Chad is facing multiple health crises, food crises, and especially humanitarian crises that have been aggravated by the arrival of Sudanese refugees, and it has had a negative impact on a very fragile health system. Chad reaffirmed its commitment in improving health and nutrition of women, infants, and young children to be able to achieve the SDGs. To reinforce the nutrition, we have implemented government bodies that are working on nutrition, and we have also operationalized the One Health platform. Amongst others, we have a law on breast milk substitutes as well as a national policy on nutrition. We also have an intersectorial plan of action. Chad has also drafted a law on the taxation of unhealthy foods to fund nutrition programs. Thank you.
Thank you. I give the floor to Burundi, followed by India.
Merci, Monsieur le Président.
Thank you, Chair. Burundi wishes to align itself with the regional statement delivered by Lesotho. We commend the Director General's report on maternal, infant and young child nutrition and the importance of nutrition for the first 1,000 days of life. We commend the role played by WHO, particularly in promoting breastfeeding and young child health. And we know that in our country, we have around 85% of exclusive breastfeeding in the early days of life, and we are very much aware of the benefits of breastfeeding and its importance, especially for Indigenous peoples. However, despite all of this progress, we still face significant challenges. We have some problems of chronic malnutrition affecting some children. In other words, there is still a fundamental threat to their survival and development. Now, we know that recently there was a case of contaminated breast milk substitute, and this emphasizes the importance of surveillance and appropriate guidance from WHO. Thank you.
Thank you. I give the floor to India, followed by Brazil.
Thank you, Chair. We acknowledge that nutrition is a critical pillar for achieving the Sustainable Development Goal and recognize that healthy and well-nourished children are the backbone of a healthy nation. India acknowledges that the first 1,000 days of life constitute a critical window of opportunity for ensuring optimal growth and development for both mother and child, and addresses this comprehensively through integrated multi-sectoral programs such as infant and young child feeding, anemia-free India, vitamin A supplementation, home-based newborn and young child care, intensified diarrhea control fortnight, and National Deworming Day. Chair, India reaffirms its commitment to improving child survival and the health of mothers and children through intensified and targeted interventions. We also support the resolution to continue focusing on maternal, infant, and young child nutrition. Thank you.
Thank you. I now give the floor to Brazil, followed by Uruguay.
Mr. Chair, in item 24, Brazil appreciates the work undertaken to advance the development of this global plan of action, a matter of utmost importance to us. Meaningful consultation with indigenous peoples is central to this process, and we commend the Secretariat's engagement with experts in the development and revision of the draft. At the same time, Brazil notes with concern the limitations of consultations conducted exclusively online and stands ready to work with WHO and member states to ensure an inclusive process leading to a global plan of action for consideration in 2027. Addressing the health of indigenous peoples is inseparable from tackling broader health inequalities, including those relating to nutrition. In this regard, we reaffirm its strong commitment to achieving the global nutrition targets by 2030, with particular attention to maternal, infant, and young child nutrition as a foundation for health, development, and equity. Nutrition remains a central priority to Brazil's public policies, including the protection and promotion of breastfeeding and the full implementation of the International Code of Marketing of Breast Milk Substitutes. I thank you.
Thank you. I now give the floor to Uruguay, followed by Singapore.
Thank you very much, Mr. Chair. Uruguay believes that the documents are aligned with our plans and strategies that we have in terms of maternal, infant, and young child nutrition. The national indicators show that there has been a prevalence that is lower than the global average in terms of childhood overweight and wasting. However, there is problems with being overweight. This is over the national average. The breastfeeding rate has achieved this average rate, and we need to work to achieve all the targets of 2030. Uruguay will be looking at these challenges through different interventions throughout the life course, reinforcing policies on healthy nutrition, good labeling, as well as marketing of healthy products. We also recognize the importance of working on legislative measures to improve the protection of breastfeeding, as well as dealing with challenges of transporter digital marketing of breast milk substitution.
I now call on Singapore, followed by Paraguay.
Chair, Singapore thanks the Secretary for the report and commends WHO's progress in implementing the plan on maternal, infant, and young child nutrition. To address persistent challenges like childhood obesity, interventions should begin from preconception and continue through childhood. We have updated guidelines for gestational diabetes and published our first guidelines for early feeding practices, supporting healthcare providers and parents in targeting upstream risk factors for childhood obesity. Supportive home and school environments are critical in shaping children's dietary habits. Singapore promotes healthier eating at home through health education for children and practical resources for families, while ensuring healthier school food options through updated nutrition recommendations and enhanced support for canteen vendors. Singapore stands ready to share our experiences and work with WHO and member states to improve maternal and child nutrition for healthier future generations. Thank you.
Thank you. I give the floor to Paraguay, followed by Mexico.
Gracias. Thank you very much, Mr. Chair. We would like to thank the Secretary for the report. We are particularly attached to the health of Indigenous peoples. We have a National Directorate of Indigenous Peoples, and there's a representation of the 19 Indigenous peoples in our country. This has allowed us to strengthen governance, to generate data, as well as the inclusion in primary health care of programs for Indigenous peoples. We want to have a free and fair, informed consent to consultations and make sure that they are inclusive, that are culturally pertinent, with full participation of Indigenous peoples and other interested parties. In the area of maternal, infant, and young child nutrition, Paraguay would like to highlight its comprehensive nutritional plan. We have a public policy for the prevention of malnutrition, and we have support here for breastfeeding, as well as marketing of healthy products. We affirm our support for breastfeeding programs and the protection of young children. Thank you.
I now call on Mexico, followed by Morocco.
Gracias, Presidente.
Thank you very much, Mr. Chair. Mexico highlights that the health of Indigenous peoples and Afro-descendants must be addressed with an intercultural, intersectional, gender, and human rights-based perspectives that is based on ethical information that is disaggregated with the effective participation of communities. We take note of the fact that the plan has not yet been finalized. We do agree with the postponement. However, we are worried about its delay. We need to advance quickly towards a clear operational framework. We need to have effective follow-up and full participation of Indigenous peoples. On item 25, we would like to emphasize the importance of protection of maternal breastfeeding, as well as the implementation of the code. We think that we need to strengthen international rules, as well as apply monitoring frameworks and look into conflicts of interest, especially in digital spaces, in line with the recommendations that have been put forward in the report.
Thank you very much. I give the floor to Morocco, followed by Indonesia.
Thank you, Mr. Chairperson. The Kingdom of Morocco has studied the Director General's report, especially with regards to the obesity in children, and we have seen tangible progress because malnutrition has decreased and obesity to less than 3%, but these results are accompanied by the lack of good food components, especially this is a challenge that impacts every woman amongst three, which requires targeted responses based on scientific evidence. This shows that we have to have a fully integrated nutrition system that is compatible with comprehensive primary care, and the Kingdom of Morocco is committed to continue its efforts with the WHO. Thank you, sir.
Now give the floor to Indonesia, followed by the United Kingdom.
Thank you, Chair. We consistently support international efforts to empower and protect indigenous communities. There is no one-size-fits-all definition of indigenous people, and the concept is not applicable in our national context. As a former colony, Indonesia comprised multicultural and multi-ethnic communities with a demographic composition that remained relatively unchanged before, during, and after independence. Our constitution, however, mandates the promotion and protection of traditional collective rights of our sub-ethnic communities, referred to as customary law communities. Our government spares no effort to promote and protect their rights and liberties, and this reflects the broader reality that diverse national circumstances of member states must be duly taken into account in the development of the Global Plan of Action. We take note of the recommendation to defer consideration of the Global Plan of Action, and this should be used to ensure close and meaningful consultation with member states, particularly in Geneva. We have submitted extensive written inputs and stands ready to engage constructively in further consultation and refinements of the draft. Thank you.
Thank you. I now give the floor to the United Kingdom, followed by the Philippines.
Thank you, Chair. The United Kingdom welcomes the report on maternal, infant and young child nutrition. Despite some progress made, it is sobering that no country is on track to meet the targets. Worsening trends in minimum dietary diversity and rising childhood obesity, including in the UK, are particularly concerning. Efforts should focus on expanding coverage of nutrition interventions for vulnerable populations and on increasing access to affordable and acceptable healthy diets. This includes supporting breastfeeding and regulating the digital marketing of breast milk substitutes. We welcome WHO's efforts to promote healthy diets and the establishment of the Anemia Action Alliance for Multisectoral Action. Integrating nutrition objectives into different sectors to pursue co-benefits and maximize available resources is crucial. To advance integration, we launched the Global Compact for Nutrition Integration. We are committed to strengthen integration in our ODA programs and track progress using the OECD DAC nutrition policy marker. We encourage others to join the 84 signatories to date.
Thank you. The Philippines, followed by Palestine.
The Philippines wishes to intervene on Agenda 24. The Philippines supports the fair consideration of the draft Global Plan of Action for the Health of Indigenous Peoples with the 80th World Health Assembly. This extension is vital to ensure meaningful, inclusive consultation with the member states' indigenous peoples. With a significant indigenous and ethnic population, the Philippines views the Global Plan of Action as a critical tool to reinforce our Universal Healthcare Act, Indigenous Peoples' Rights Act, and the National Strategic Plan for Indigenous Peoples' Health. However, successful implementation requires a tailored approach that respects diverse national contexts. The efficacy of the Global Plan of Action rests upon the strength of its foundations. We therefore urge the Secretariat to facilitate the provision of the necessary funding support to enable member states to conduct truly inclusive multi-sectoral consultations. By investing in these collaborative processes, we ensure a global plan of action that is only not culturally sensitive but operationally viable. Thank you, Chair.
Thank you. I now give the floor to Palestine, followed by Belgium.
Thank you, Mr. Chairperson. In Palestine, particularly Gaza Strip enclave, the catastrophic situation due to the Israeli occupation, genocidal war and blockade result in extreme food insecurity. Over 90% of young children and pregnant breastfeeding women face severe food poverty with minimal and extremely limited dietary diversity. Nutrition is compromised by a lack of hygiene, clean water, safe feeding, and acute malnutrition, increasing the risk of mortality. Pregnant and breastfeeding Palestinian women face high risk, including severe malnutrition. Poor nutrition is coupled with extreme stress, trauma, and the horrific conditions of life, living in crowded IDP shelters. Approximately 126,000 children under 5 are at risk of failing to meet their full developmental potential due to starvation and poor nutrition imposed by the Israeli colonial regime. To conclude, Palestine takes note of the report on maternal, infant and young child nutrition. I thank you.
Thank you. I give the floor to Belgium, followed by the Marshall Islands.
Thank you, Chair. Belgium aligns with the EU statement on item 25. The stagnation and even reversal in progress toward the global nutrition targets is alarming. We are highly concerned by the rising prevalence of child obesity, as well as by the high consumption of sugar-sweetened beverages and ultra-processed food. We thank WHO for its leadership and recent collaboration with Belgium for our National Symposium on Nutrition and Public Health and for discussion on preventing iodine deficiencies in Europe. Nutrition policies must be rooted in independent, evidence-based guidance rather than relying on industry self-regulation or being influenced by commercial and political interest. In this sense, recent food safety crises affecting powder infant formula are deeply worrying. Independent and transparent handling of this risk and contamination is essential, alongside unhindered and continued promotion of breastfeeding. Thank you, Chair.
Thank you. I now give the floor to the Marshall Islands, followed by Ireland.
The Republic of the Marshall Islands wishes to highlight the unique challenges facing maternal and child health and nutrition in the Pacific Islands region, where we face the dual burden of high stunting rates alongside some of the highest maternal obesity rates in the world. Recent statistics indicate that 3 in 4 mothers in our country are overweight or obese, and 1 in 4 households has both an overweight or obese mother and a stunted child. This represents a serious public health crisis, placing both our mothers and our youth at heightened risk. In response, we are collaborating with the World Bank and UNICEF in implementing the multi-sectoral Early Childhood Development Project, which aims to strengthen access to essential reproductive, maternal, newborn, and child health and nutrition services. Cross-cutting efforts from all actors and partners must be strengthened, so we call on the WHO to invite the Republic of China, Taiwan, to all technical meetings, activities, and mechanisms and participate as an observer in the WHO. They are a leader in promoting healthy mother-child nutrition, including through the promotion of breastfeeding, pursuant to their Public Breastfeeding Act. Komodada, and I thank you, Chair.
Thank you very much. I now give the floor to Ireland, followed by Canada.
Chair, Ireland aligns with the statement delivered by Bulgaria on behalf of the European Union. Ireland welcomes the report of the Director General, whilst recognising the challenge faced globally in achieving these targets by 2030. Malnutrition in every form presents a significant threat to human health. We as Member States must strive to answer the call of the SDGs to see malnutrition in all its forms ended by 2030. At WHA 78, Ireland was proud to have sponsored with Ethiopia the resolution on extension of the Comprehensive Implementation Plan on Maternal, Infant and Young Child Nutrition, which called on Member States to renew and extend commitments to address maternal, infant and young child nutrition. Specifically, it called for scaled-up integration of essential nutrition actions in healthcare and to build capacity. The resolution included operational targets which galvanise concrete actions on key nutrition priorities in the next 5 years, consolidating global efforts to reach the targets by 2030. Ireland calls for the full implementation of the resolution and through its development cooperation programme will continue to prioritise maternal, infant and young child nutrition. Thank you.
Thank you. I now give the floor to Canada, followed by Ecuador.
Canada is committed to improving global results when it comes to nutrition. We emphasize the need to step up nutritional interventions that are based on evidence and take account of gender. These should be supported by multilateral alignment, integration of services, policy coherence, and the mobilization of national resources.
Additionally, Canada supports updating WHO normative guidance and model regulatory frameworks restricting digital advertising of breast milk substitutes. Strengthen monitoring and enforcement tools, including digitally adapted surveillance systems, standardized indicators, and capacity building are key for regulators. Engagement with civil society, consumer protection agencies, and technology platforms also enhances compliance and accountability. Canada looks forward to WHO's support to Member States in implementing these measures and clarity on timelines for updating guidance and developing enforcement tools. Thank you.
Thank you. I give the floor to Ecuador, followed by Cuba.
Gracias, señor presidente.
Thank you very much, Mr. Chair. Ecuador welcomes the presentation of the document on maternal, infant, and young child nutrition. We recognize that malnutrition in all of its forms continues to represent a priority challenge for human development, for equity, as well as for the achievement of the SDGs, particularly in early childhood. In line with this, Ecuador has been implementing a national strategy, Ecuador is Growing Without Childhood Malnutrition, that is focused on the strengthening of maternal and young child nutrition through the coordination of goods and services. It has also protected and promoted and support for breastfeeding. There are many different activities that have been developed, such as the breast milk banks, breastfeeding friendly spaces, groups of support. Likewise, the country has a normative framework that includes the Organic Law on Organic Childhood, the law on malnutrition, food guides, as well as nutrition labeling, which allows us to operationalize all of these different activities. Lastly, we support the Global Plan of Action on Maternal, Infant, and Young Child Nutrition and reaffirms its importance for the achievement of global targets. Thank you.
Thank you very much. I now give the floor to Cuba, followed by Colombia.
Thank you very much, Mr. Chair. Cuba appreciates the presentation of the report, EB 15830, and takes note of the progress that has been made in the implementation plan on maternal, infant, and young child nutrition. Even though we have seen advances in reducing stunting, wasting, and we see that all the indicators are not on the right track to be able to achieve the 2030 targets, especially regarding anemia, childhood low birth weight. We are concerned with these. Cuba welcomes the extension of the Decade on Nutrition. We appreciate the work of the WHO on these new guidelines for for canteens at school, for example, as well as the review of standards for breastfeeding. And we want to affirm our support for the One China policy. This is not a place to debate to Taiwan. We have reinforced our legal framework to align itself with the breastfeeding, the code of marketing of breast milk substitutes. Thank you very much for your attention.
Thank you. I now give the floor to Colombia, followed by Ethiopia.
Gracias, señor.
Thank you very much, Mr. Chair. Colombia would like to appreciate the report and the 5 plans that has an intercultural focus that is based on human rights, that is looking into climate change, the loss of biodiversity, as well as pollution. This is contained in the report. This plan is essential to recognize that the disproportionate impact of social determinants on indigenous people's health. There is a historical debt that exists, and we are part of the COP26 on biodiversity. We adopted a decision on biodiversity and health, which recognizes how the environment affects people's quality of life. We continue valuing the support of the WHO with capacity building at the national level. We have had technical workshops, the use of data, as well as help with consultations that are culturally appropriate. We have had an exchange of good practices as well as mobilization of resources, and WHO has helped with this. We would like to extend the plan to make sure that there are significant consultations that take place with indigenous peoples.
Ethiopia, followed by Zambia.
Thank you, Mr. Chair. Ethiopia thanks the Director General for the report on maternal, infant, and young child nutrition. Ethiopia welcomes the extension of the UN Decade of Action on Nutrition to 2030 and the outcomes of the Paris Nutrition for Growth Summit. We have integrated all 6 global nutrition targets into our national policies and are strengthening implementation through our health extension program and community-based nutrition interventions. We particularly support the establishment of the Anemia Action Alliance, given the persistent challenges of anemia among women and children. On accelerating interventions amid funding cuts, we recommend strengthening domestic resource mobilization, leveraging nutrition-sensitive social protection mechanisms, and exploring new, non-traditional, and innovative sources of financing. Ethiopia is committed to promote optimal breastfeeding and has strengthened its code legislation accordingly. We call for continued support in the effective regulation of cross-border digital marketing. Last but not least, we also urge countries to accelerate the implementation of WHA 78.24 on the extension of the Comprehensive Implementation Plan on Maternal, Infant, and Young Child Nutrition. I thank you.
Thank you. I now give the floor to Zambia, followed by Democratic Republic of Congo.
Thank you, Chair. Zambia aligns with the Afro Group statements. On item 25, Zambia acknowledges the report on maternal, infant, and young child nutrition and notes the progress made in achieving some of the global targets. To address the high prevalence of stunting, Zambia has been implementing a national multi-sectoral scaling up nutritional program. Additionally, the country has rolled out the school feeding program across the country. We welcome WHO's technical assistance to the Global Alliance Against Hunger and Poverty, as this will strengthen member states' nutrition-sensitive health systems. On item number 24, Zambia supports the proposal to allow wide consultation of member states, indigenous people, and all relevant stakeholders to ensure the formulation of an effective global plan of action. I thank you.
Thank you very much. I now call Congo, followed by Tanzania.
Merci, Monsieur le
Thank you, Chair. Chair, the DRC wishes to begin by thanking the Director General and commends him on the high quality of the document on maternal, infant and young child nutrition, and we align ourselves with the statement delivered on behalf of the Africa region. We have seen from the recent survey that there is a serious problem with stunting and also with overall malnutrition in our country. We've also seen that more than 52% of women of childbearing age in the country are subject to anemia. Therefore, we have developed a multi-sectoral nutrition plan. This is intended to develop a human capital in our country that can really be healthy and contribute to building our society. We have recognized that a number of things have to be done. Firstly, we have to increase our domestic resources available for the purchase of nutritional supplements. We also have to seek to combat the marketing of breast milk substitutes. Thanks to the actions that we intend to undertake with the support from WHO, we hope that we will be able to significantly improve our results in future.
I now go to Tanzania, followed by Nigeria.
Thank you, Chair. The United Republic of Tanzania commends WHO leadership in advancing global nutrition efforts. While acknowledging progress since the plan's endorsement, we remain concerned that the world is off track to meet the 6 global nutrition targets and several operation targets by 2030. Tanzania welcomed the extension of the UN Decade of Action on Nutrition to 2030 and the outcome of the Paris Nutrition for Growth Summit 2025, which together with the G20 Global Alliance Against Hunger and Poverty strengthen our efforts towards nutrition-sensitive policies for maternal, infant, and young child nutrition. We express concern over the increasing unregulated digital marketing of breast milk substitutes that undermine breastfeeding. And in this regard, Tanzania calls for sustained global solidarity, strong WHO leadership, and enhanced technical support to safeguard nutrition gains. I thank you.
Thank you. I now give the floor to Nigeria, followed by Turkey.
Thank you, Chair. Nigeria aligns with the statement delivered on behalf of the African region, and we thank the Director General for this important and timely report. Nigeria aligns itself with the goal of accelerating progress towards the global nutrition targets and the comprehensive implementation of maternal, infant, and young child nutrition. We are concerned that all 6 global nutrition impact targets remain off track, with stagnation in anemia, low birth weight wasting, childhood overweight, and insufficient progress in exclusive breastfeeding. At the same time, cuts in development assistance for nutrition threaten to reverse hard-won gains and increase preventable child deaths. In this context, making primary health care the organizing principle for nutrition action is not optional, it is essential. Nigeria encourages WHO to strengthen structured learning platforms focused specifically on PHC-based nutrition. With stronger alignment of global support behind PHC, enhanced country capacity, and vibrant knowledge exchange, we believe the global nutrition targets can still be brought within reach, even in a constrained financing environment. Thank you.
Thank you very much. I now give the floor to Turkey, followed by the Dominican Republic.
Thank you, Chair. We would like to thank the Secretariat for the progress report on maternal, infant and young child nutrition. The well-designed tables 1 and 2 included in the report clearly shows the global situation. At the same time, these tables demonstrate that both the Secretariat and all Member States need to intensify their efforts in order to achieve the 2030 targets. We also appreciate the documents highlights the global cut to development assistance, as well as its call for member states' advice on breastfeeding and digital marketing tools. We consider this approach valuable and hope that the discussion will be resulted with expected outcomes. I thank you.
Thank you very much. I now call the Dominican Republic.
Thank you very much. For the Dominican Republic, the implementation plan on maternal, infant, and young child nutrition is a key tool to be able to improve the health of mothers as well as children through appropriate nutrition that helps with the sustainable development. We are very pleased to inform the EB that we are above the average of exclusive breastfeeding rates. To accelerate advances, it is fundamental to strengthen nutritional education and to include nutrition in healthcare services to ensure that there is capacity building of healthcare workers, as well as making sure that supplements are distributed. And we need to have effective monitoring systems and use of innovative technologies. Likewise, the country underscores the need for legal frameworks, surveillance mechanisms that limit the digital marketing of breastfeeding substitutes, and continues to promote exclusive breastfeeding. Thank you.
Thank you very much. I see no other member states seeking the call. I would just like to check whether any observers, UN bodies or IGOs wish to take the call. I do not see anyone seeking to take the call. We now have individual statements by non-state actors. I will start by calling Médecins Sans Frontières International. You have the floor.
Thank you, Chair. On agenda item 24, MSF welcomes WHO's proposal on the Global Plan of Action. MSF witnesses how indigenous communities are being disproportionately affected by preventable disease. MSF restates the need for an intercultural approach, understanding that mental, physical, and environmental health are indissociable. Failure in protecting health holistically can result in mental health consequences. From experience working with Brazilian Yanomami context, MSF considers the plan's prioritization of centering social participation and meaningful leadership of indigenous peoples in all phases of decision-making process essential. The plan must be informed by indigenous peoples as protagonists of change towards more accessible, acceptable, and adapted health services. Finally, MSF stresses the need to respect traditional medicines and knowledge, encouraging dialogue with traditional healers and communities to improve health services and outcomes. We look forward to upcoming discussions. Thank you.
Thank you. I now give the floor to Medicines for Malaria Venture. You have the floor.
Thank you, Chair. Medicines for Malaria Venture, MMV, welcomes a robust plan of action for the health of indigenous peoples, including access to innovation to address infectious diseases, which are a major health challenge for these populations. In several malaria-affected countries, indigenous people suffer from very high infection rates, reaching over 50% of cases in some areas. For these communities living in remote locations, availability of effective, safe, and easy-to-administer prevention and treatment is crucial. As an organization which has been working closely with committed governments and indigenous communities to address relapsing malaria in the Amazon region, we are proud to have contributed to improving access to innovative and appropriate medicines to these underserved populations, and we are committed to continue to do so as part of our regional disease elimination and global eradication goals, and we are keen to support the plan of action. Thank you.
Thank you. I now call International Federation of Medical Students Associations. You have the floor.
Esteemed delegates and chair, this statement is also supported by the International Pharmaceutical Students Federation. As a young healthcare professional shaped by the Canadian context, I wish to share challenges that will resonate with other countries home to Indigenous communities. Daily at the hospital, I witness Indigenous patients navigating persistent health inequities. Life expectancy remains 10 years lower than the national average. 75% report unmet mental health needs, and structural discrimination and historical injustices act as active barriers to care. And these are not just numbers, but live realities that demand actions. First, holistic interdisciplinary care addressing social determinants of health. Second, medical education integrating cultural safety. And thirdly, meaningful inclusion of Indigenous peoples in policymaking, including transparent and accountable consultations for the draft Global Plan of Action. Only through shared listening, learning, and action can health systems truly serve everyone with equity and respect. Thank you.
Thank you. I now give the floor to Movendi International.
Thank you, Chair. Movendi International welcomes the proposed deferral of the Global Plan of Action for the Health of Indigenous People to allow further consultations. This additional time is very useful to ensure critical improvements regarding alcohol policy. Through our consultations with Indigenous communities in the Americas, Africa, and Asia Pacific, alcohol harm consistently emerged as a major driver of violence, injury, and mental ill health. Alcohol harm in Indigenous communities is often disproportionately high and is a result of colonialism, corporate exploitation, and commercial determinants, as well as policy failure. We call on the Secretariat and Member States to fast-track alcohol policy for health promotion in Indigenous communities. Thank you.
Thank you. I now give the floor to the World Cancer Research Fund International. You have the floor.
This statement relates to agenda item number 25, maternal, infant and young child nutrition. World Cancer Research Fund International welcomes the Director General's update. We share concerns with partners, including the Union for International Cancer Control. The progress for achieving all 6 impact targets by 2030 remains off track. As reported by UNICEF, obesity is now the most prevalent form of malnutrition for school-aged children and adolescents globally, with the exception of sub-Saharan Africa and South Asia. Obesity increases the risk of 13 different types of cancer, and without intervention, countries will face a lifetime of health and economic impacts. We therefore urge Member States to accelerate the implementation of policies that support Item 25's proposed actions, in particular improving food environments through comprehensive food and nutrition policies, including restrictions on marketing of breast milk substitutes, and increasing investment. Member States should utilise multi-sectoral approaches but strictly manage conflicts of interest to achieve optimal policy outcomes. Thank you.
Thank you. I now give the floor to the NCD Alliance.
Thank you, Chair. The NCD Alliance welcomed WHO updates and commends governments championing the acceleration plan to stop obesity, as well as those that have adopted legislation aligned with the International Code of Marketing of Breast Milk Substitutes, protecting mothers and children. However, only 33 countries have legal measures aligned with the code, and that progress on optimal breastfeeding will fall short of 2030 targets without stronger legislation and enforcement. We are also alarmed by the high sweet beverage consumption among young children, fueling the childhood overweight epidemic. We urge Member States to integrate current targets into national nutrition and NCD strategies, accelerate evidence-based policies, including taxation on sugary drinks, front-of-package labeling and marketing restrictions that protect children, strengthen breastfeeding protections in line with WHO guidance, and safeguard nutrition policymaking from conflict of interest. Thank you.
Thank you. I now give the floor to Save the Children Fund.
Thank you, Chair. Children are paying the price of global funding cuts and growing crisis, driving a deepening child nutrition emergency. Preventable deaths and famines are only the visible consequences. With the extension of the WHO nutrition targets, we call on member states to prioritize the first 1,000 days from pregnancy through a child's second birthday, critical for their survival and development, and include adolescents and anemia and overweight. Integrate nutrition within public health policies and across all sectors to provide the strongest foundation for children to survive and thrive, including in humanitarian contexts. Ensure the resolution on digital marketing of breast milk substitutes and the code are translated into national law. Thank you.
Thank you. I now give the floor to the Global Self-Care Federation.
Chair, distinguished delegates, GSCF recognises the WHO Global Nutrition 2030 targets on maternal, infant and young child nutrition. To achieve the 2030 impact targets, policymakers and health systems must prioritise the provision of micronutrient supplements as highlighted in the 2025 WHO topical briefs. Vitamin and mineral supplementation is a high-impact, cost-effective public health investment with wide benefits for maternal, infant and child nutrition and beyond. It advances equity by supporting vulnerable groups, including pregnant women and children. It contributes to universal health coverage by reducing healthcare costs through preventative action. It also supports NCD prevention, as iron, folate, iodine, calcium, and other micronutrients reduce anemia, maternal mortality, and preterm birth, lowering lifelong NCD risks. Finally, supplementation strengthens health system resilience by improving immunity and supporting preparedness for pandemics and crises. Thank you.
Thank you. I now give the floor to the International Lactation Consultant Association.
Thank you, Chair. ILCA welcomes the DG's report on maternal, infant, young child nutrition, emphasising breastfeeding as a life and cost-saving intervention. Low breastfeeding prevalence costs $1.1 billion a year in treatment costs alone. Budget pressures make leadership in infant and young child feeding, especially within WHO, ever more critical. WHO recommends 6 or more counselling contacts per mother. Countries must invest in training the workforce for skilled lactation care to achieve these breastfeeding goals. Commercial milk formula marketing undermines breastfeeding. Repeated contamination-related formula recalls, including the recent cellulite toxin cases, have caused serious illness, family distress, and inequitable access to healthcare with inequitable access. This urgently demands stronger global safety and hygiene standards and updated preparation guidance by Codex and WHO with robust controls in member states.
I now give the floor to the International Pharmaceutical Students Federation.
Thank you, Chair. Honourable Chair, distinguished delegates. This statement is supported by the International Federation of Medical Students Association, IFMSA. I speak today not only as president of the International Pharmaceutical Students Federation, but as a young mother who was able to breastfeed for 2.5 years. Yet, this is not the reality for most families. 52.6% of mothers and children never get the chance to exclusively breastfeed for the first 6 months. We are the generation that must ensure that the 2030 breastfeeding and nutrition targets are met. Therefore, we urge member states to adopt national family-focused policies, sufficient paid parental leave, postpartum support, child benefits, and guaranteed access to nutritious food for mothers and children, and to ensure that returning to work never forces to choose between their careers and their families for the mother. Thank you.
Thank you. I now give the floor to the International Baby Food Action Network.
Thank you. Contamination of commercial formulas has led to infant mortalities, fatalities, factory closures, interrupted supplies, legal actions, and much distress to families. They have exposed systemic failures in formula production, regulatory surveillance, recall systems, and crisis management. Cross-border social media marketing exacerbates the food safety risks, enabling contaminated, unregistered products to enter countries where treatment may not be available. The idealized marketing misleads and instills unquestioning trust in a risky product. Governments must take the lead in changing food safety cultures and ensure independent verification. Manufacturers and authorities must listen to, not punish, whistleblowers. Codex and WHO guidelines are now nearly 20 years old and no longer adequate. A global response led by WHO is urgently needed to better protect families whose trust is betrayed. Please.
Thank you very much, and thank you for all the non-state actors for that information for the committee. I see there are no other requests from the floor, so I'm going to turn to the Secretariat to respond to any questions that have been raised. Start with the Chef de Cabinet, and then I'll go to Dr. Farah. Chef de Cabinet, you have the floor.
Thank you, Chair. Thank you, Member States, as well as the NSAs who spoke, and for your recognition and support for the revised time frame, including the deferral for consideration of the draft Global Plan of Action on the Health of Indigenous Peoples to the 80th World Health Assembly through the Executive Board at its 160th session. This revised timeline will enable deeper and more inclusive consultations across all WHO regions, including with Indigenous peoples, to ensure meaningful engagement grounded in the principle of free, prior, and informed consent. We take note of the strong support expressed for the 5 priority areas outlined in the plan, as well as their alignment to the GPW 14. We also take note of the specific requests made to advance this work and will follow up accordingly. The Secretariat remains fully committed to delivering the Global Plan of Action, and is making steady progress in its development. Regional consultations are being scheduled in all regions, and we urge Member States and partners to actively engage in these processes ahead of a global consultation to be convened later this year to ensure that diverse perspectives of stakeholders, especially those of Indigenous peoples, are fully reflected. We will continue to keep the Member States informed of the plan consultations and progress in the development of this Global Plan of Action. This work reflects our collective commitment to the enjoyment of the highest attainable standard of health as a fundamental right to every human being, as enshrined in the WHO Constitution. Thank you so much. Over to you, Chair.
Thanks very much. Thanks very much, Chair. And again, thanks very much to all Member States for the continued support on the whole issue of advancing nutrition, and here, obviously, on maternal, infant and young child nutrition. We, again, face an inflection point where we continue to have in many regions, many countries, undernutrition and malnutrition, and in the same context and often in the same communities, growing obesity, the challenge of the growing obesity. These long-term consequences of maternal and early life nutrition clearly have acute and short-term consequences on the mother and the baby. It's clear from scientific evidence that the long-term consequences through the life course of that first 1,000 days are very profound and long-lasting. Also thank the many comments from Member States around protecting breastfeeding and preventing digital marketing of breastfeed substitutes. Last year's milestones from the team within the nutrition team, Nutrition for Growth Summit, adoption of the 2030 Global Operational Targets to drive action, and extension of the UN Decade of Nutrition, all of which were vital to maintaining the momentum on this critical issue. We will remain in 26 and 27 focused on our core mandates, convening power, technical support and support to countries as requested, including acceleration plan to stop obesity, the global action plans for wasting and anemia, and the RECAP project to accelerate progress for the 2030 targets. There are a number of comments about the global food supply, and that is becoming increasingly complicated and complex, and we will continue our work through InfoSan with our partner at FAO on ensuring the safety of the global food supply. Thank you.
Thank you very much for that, and thank you for responding to those questions. I see no request. As I see no more requests for the floor, may I take it that the Board is ready to note the reports contained in documents EB 158/29 and EB 158/30. I see no objection. The reports are noted. Let us consider the draft decision now contained in document EB 158/29. Is the Board ready to adopt the draft decision provided in paragraph 17 of the document EB 158/29 to defer consideration of the draft Global Plan of Action for the Health of Indigenous Peoples to the 80th Health Assembly? I see no objection. The decision is therefore adopted. Thank you. This concludes the Board's considerations of items 24 and 25. Those items are now closed. Let us turn to the next item. Colleagues, we've made excellent progress in our program today. I'm just going to outline how I see the rest of the day going. Next, we'll turn to sub-item 27.1 on financing and implementation of the program budget 24-25 and outlook on the program budget 26-27. Following consideration of that sub-item, we will proceed to the grouping of the first three sub-items under item 28. All of these items are ones that have been covered extensively at PBAC, so there's a possibility these will be relatively quick items. I wonder if that is sort of famous last words. But on our program today, we also have sub-item 28.4 on governance reform. As the revised decision point on member state-led governance reform was just posted earlier this morning, I would like to propose that we defer consideration of that item to allow delegates more time to review it. So we'll start tomorrow morning with that if we get that far. In order to make good use of the time, if we have the time, only if we have the time, if the Board agrees, I'd like to propose that we move up another item on our agenda, which is item 34, report of expert committees and study groups, to use the time. Are there any objections to this proposal? No, I see no objections. I should also note that there is one member state who's requested a right of reply. Again, I would like to apologise to the delegation from China. We inadvertently didn't call that right of reply straight away. That was just an administrative oversight. But to ensure we can accommodate that right of reply and ensure we have translation, my intention was we'd move to that at about 5:25, give or take, depending on how the thing goes, which just gives us 5 minutes in the normal course of offence, but another 15 minutes within the grace period, so that we're not rushed through that. So that would be my intention for the rest of the day. So as we move to the power and performance section of agenda, I recall we have a number of items under the section that have already been discussed extensively last week during the PBAC, with some concrete recommendations provided by that committee in document EB 158/4. Following my earlier announcement, in order to be efficient when we take up such items, I will draw your attention to the recommendations of the PBAC and request that you take the floor only in the event that you do not agree with those recommendations. I do count on your cooperation in that regard. We will now consider sub-item 27.1, financing and implementation of the program budget 2024 to 2025 and outlook on the program budget 2026 to 2027. The relevant report is contained in document EB 158/32. As this sub-item was discussed by the PBAC, I shall draw your attention to the report of the committee contained in document EB 158/4, paragraph 14 to 22. I would like to invite the PBAC Chair and the Secretary to read out the recommendations of the PBAC. Dr. Mungundizi, you have the floor, and Secretary of Law.
Thank you, Chair. With respect to the item 27.1, the committee recommended that the Executive Board note the report of the Secretariat on the financing and implementation of the Programme Budget 2024 to 2025 and the financing outlook for 2026 to 2027. It further proposed as guidance for the Secretariat's implementation of existing mandates that the Secretariat should A. Continue efforts towards a more equitable allocation of resources based on the outcome of the prioritization process, using equity-focused allocation criteria, including the heat map, to address funding gaps with an increased focus on the regional and country levels. B, work with member states to ensure that agreed priorities are adequately funded. And lastly, C, continue working with member states to mobilize predictable, flexible, and sustainable financing while continuing to ensure transparency and accountability. Thank you, Chair.
Thank you very much. The floor is now open. Kindly indicate your intention to speak only if you do not agree with the recommendations of PBAC. I recognise Israel.
Thank you, Chair. Israel welcomes the report on program budgets. While we can clearly see where financing levels are high or low, we have far less visibility into the operational implications of these figures. The Executive Board can play a more substantial role than it has thus far in guiding WHO towards sustainable budgeting and more effective programming. In this vein, the Executive Board would benefit from having access to greater granularity about costs, including allocation of resources for specific WHO programs. On a similar note, the report also provides limited clarity on the criteria, governance processes, and timelines for program allocation. This weakens member states' ability to assess whether resources are being deployed in a timely, strategic, and accountable manner. We stress that any call on member states to increase contributions, assessed or voluntary, must be accompanied by a clear, prioritized plan of work with stronger reporting on implementation, clearer justification for allocation decisions, and more explicit linkages between financing and measurable results. A disciplined approach is also essential to prevent mission creep and ensure that limited resources are focused on agreed priorities. Strengthening sustainability, credibility, and trust will require not only more flexible financing, but also deeper transparency on how resources are translated into impact. Thank you.
Thank you. Again, I would like to stress it's where members disagree with the recommendation of PBAC. Those are observations, are very valid observations. They're very much observations that were made during the PBAC discussion, which went on for a number of days. Bulgaria, you have the floor.
Chair, I have the honor of speaking on behalf of the European Union, its 27 member states. The candidate countries North Macedonia, Montenegro, Serbia, Albania, Ukraine, Republic of Moldova, and Georgia, as well as Armenia, align themselves with this statement. The past year has put the WHO and the whole multilateral system to the test, a test with major financial implications. Against this backdrop, it is more important than ever to protect the WHO by ensuring more financial flexibility. Important steps have been taken through the increase of assessed contributions, as agreed at World Health Assembly 75, which remain the most stable financial basis for the organization. Simultaneously, you commend WHO for its ongoing successful efforts to broaden and diversify its donor base, for example, through the WHO investment round, and strongly encourage member states to provide predictable and unearmarked contributions. Solidarity and commitment to the multilateralism in these times of crisis require more member state contributors supporting the WHO through multi-annual, flexible and predictable funding. We reiterate our support to these funding reforms to make WHO fit for purpose. Funds must support program budget needs across all three levels of the organization and must not be used to advance topics outside the scope of prioritized work within the GPW14. In order to enable strategic decision-making, these priority budget needs and funding gaps, particularly persistent pockets of poverty, must be communicated to member states in a clear and timely manner, so that contributions can be utilized in the most cost-effective way. Thematic funds, investment rounds, or collaborations for the strengthening of expertise can be useful additional means to ensure the targeted and efficient use of resources in the areas of greatest need. Our common goal must be for WHO to operate effectively within the reduced program budget for 2026-2027, while ensuring that member states' priorities are adequately reflected in the organization's day-to-day work. To achieve this, we expect transparency, swift and regular updates and continuous exchanges that lead to sustainable results based on national, regional and global priorities. Taking on new areas of work or expanding existing programs should remain the exception. be budget neutral and not affect the timely and effective achievement of prioritized work within GPW14. WHO must fulfill its constitutional mandate and key functions, and do so well. We thank the Secretariat for the close collaboration and exchanges on the program budget 2026-2027, and would welcome an update by all 6 regional directors on cost savings and downsizing efforts. All 3 levels of the organization should continue to adjust to the new financial realities. The EU and its 27 member states remain reliable partners to the WHO during these challenging times. Thank you.
Thank you. I give the floor to Costa Rica.
En financiamiento.
In funding, that there have been important progress. However, we need to make sure that there is sustainability, effectiveness, as well as accountability. We see that there is flexible funding, and this has been additional funding for the region. We appreciate this. However, we would like to ask for more equity. These funds, these are voluntary contributions, but they should also meet the needs for cooperation that have been identified by countries themselves. Thank you very much. We just want to point that out.
Thank you, Costa Rica. Now, I see no further calls from EB members, and therefore I'm happy to throw it to non-EB members. I recognise Brazil. Japan was a little bit late. I will actually go... No, okay, I will go to Brazil first, because Japan has waved to me in a congenial way. Brazil first, and then Japan.
Thank you, Chair. Brazil welcomes the efforts undertaken by WHO to respond to the financial challenges arising from the current international environment. We commend the Secretariat for the significant reduction of the financial gap for the current biennium, while recognizing the unavoidable adverse impacts on the implementation of global health policies and on the invaluable staff in headquarters, regional and country offices. With respect to the Americas, Brazil notes with concern that it continues to be the most underfunded region. At the same time, we acknowledge the progress achieved in the allocation of flexible funds over the past year and encourage the organization to further advance in this direction. In conclusion, Brazil reiterates its firm commitment to the central role of WHO in global health governance. Thank you, Mr. Chair.
Thank you. Give the floor to Japan.
Thank you, Chair. Japan would like to express sincere appreciation to the tireless efforts by the Secretariat and all those concerned to ensure the implementation of essential programs despite challenging circumstances. Regarding the program budget for 26-27, while we acknowledge the approximately 85% of the budget is expected to be funded according to the Secretariat's report, we recognize that mobilizing the remaining resource of 15% will be even more challenging. Therefore, Japan believes that the measure, which is similar to those taken in the 24-25 program budget, must be further refined and applied so that WHO can be more focused on its core mandates. Addressing these challenges will undoubtedly require a change in the mindset among member states. However, while the information on the underfinanced area in 26-27 provided by the Secretariat is useful, we also believe that further efforts to enhance transparency and effectiveness needs to be made by the Secretariat. For example, we would appreciate the Secretariat's views regarding the following three measures. 1, timely sharing with member states of the funding status by targets and departments. 2, establishing clear processes for accepting additional funding once a target has fully been financed. And 3, ensuring that the necessary costs associated with the resolutions are secured in advance. In conclusion, Japan remains committed to supporting WHO together with other member states toward the realization of health for all. Thank you.
Thank you, Japan. Zambia.
Thank you, Chair. Zambia supports the continued implementation of the prioritization and realignment process for a financially stable and fit-for-purpose WHO and for country-level impact where it's needed the most. Zambia therefore calls for the following. 1, the equitable allocation of resources across the 3 pillars of the WHO. 2, a reduction of the over-reliance on earmarked funding, which reinforces inequities. 3, a focus on core mandate and functions of the WHO, which would ensure the adequate funding of core technical programs. And 3, and 4, broadening of financial bases and increasing flexible funding in order to improve predictability and enhance equity. Zambia notes with concern that outcome 2.1 under the African Region on Health Emergency Preparedness and Response remains among the least funded and implemented despite the continent's vulnerability to outbreaks and humanitarian crisis. In this regard, what strategy has been put in place in order to close the funding gap? Thank you.
Thank you very much, Zambia. I see no other requests from the floor. I shall ask, therefore, the Secretariat to provide any response to those questions. So,
thank you very much, Chair. I will try to be brief. There were questions about transparency and more information. And so I would like to say first that we're absolutely open for any suggestions how to go ahead and improve the information that we're providing. This document that you have in front of you is a very short summary of incredibly detailed information that is available on our program budget web portal, which is refreshed on a monthly basis. So there you can go into outputs, you can go into regions, you can go into countries, you can actually click on a country and see the expenditures on a monthly basis on travel, on consultancies. So I think there's a lot of information that is there, and this paper is really trying to bring it all together to a more digestible format. The second, I would like to raise the attention of particularly Israel, that we also have a digital platform to the program budget 26-27 that explains, provides explanations and short summaries of some of the issues that raised, for example, how we're distributing flexible funds, what are the criteria we're using, etc. In addition, we are basically providing every 3 months a member state briefing, either through the governing bodies or in between, about the overall financial situation and implementation, where member states have the possibility to engage in a more informal interactions. But we are open for more dialogue and more information, so let us know how we can improve that. Many thanks both to Costa Rica and to Brazil for recognizing that flexible funding has increased, the allocation of flexible funding has increased to the Americas region. And I think it is to be able to move more voluntary contributions is something that we are looking into to the region, and I think it's work in progress, and we remain committed to improve the available funding for the Americas region. And maybe the last word to Japan's. First of all, we are absolutely committed to continue the cost containment efforts that we have started, especially in 25. We're not. We would like to avoid going back to same old. In fact, just this day we had a meeting with all the regions on how to what measures to do, and we're also happy to engage further on the 2 other points that you have raised, because I think they're a little bit more complicated. And lastly, to the issues raised by Zambia, we absolutely agree in a way with all the points that you raised. Thank you for reminding us that sustainable financing is important, and we just also would like to underscore that equitable financing and equitable allocation of financing is an important element and continues to be an important element for the Secretariat, but it is somewhat limited by the amount of, by the flexibility of the voluntary contributions that we have. So it's a question of how much flexible resources we have. Thank you, Chair.
Thank you very much. As I see no further requests for the floor, may I take it that the Board concurs with the PBAC's guidance and that the report in document EB 158/32 is therefore noted. I see no objection. The report is noted. Thank you. This concludes our discussion of sub-item 27.1. We shall now consider the following grouping of items. Item 28.1 on prevention of sexual exploitation, abuse and harassment, contained in document EB 158/33. Item 28.2 on evaluation, update and proposed work plan for 2026 to 2027. And item 28.3, update on the infrastructure fund, which covers the Geneva building renovation strategy and an update on information management and technology. In relation to item 28.1 on prevention of sexual exploitation, abuse and harassment, the relevant report is contained in document EB 158/33. As this matter was discussed by the PBAC, I shall draw your attention to the report of the committee contained in document EB 158/4, paragraphs 40 to 43. In relation to item 28.2 on evaluation, update and proposed work plan for 2026 to 2027, the relevant report is contained in document EB 158/34. The financial and administrative implications are contained in document EB 158/34 Add 1. As this matter was discussed by the Program, Budget and Administration Committee, I shall draw your attention to the report of the committee contained in document EB 158/4, paragraphs 38 to 39. In relation to item 28.3 on an update on the infrastructure fund, which covers the Geneva building renovation strategy and an update on information management and technology, the relevant report is contained in document EB 158/35. As this matter was also discussed by the PBAC, I shall draw your attention to the report of the committee contained in document EB 158/4, paragraphs 62 to 66. I would like to invite the PBAC Chair to read out the recommendations of the PBAC. Chair, over to you.
Thank you, Chair. In relation to item 28.1, prevention of sexual exploitation, abuse and harassment, the committee recommended that the Executive Board note the report. It further proposed as guidance for the Secretariat's implementation of existing mandates that the Secretariat should A, continue to pursue the institutionalization of and transparent and accountability for zero tolerance for sexual misconduct and keep on integrating sexual misconduct into broader misconduct prevention and response measures across the different levels of the organization. B, encourage and continue to support member states to use the proposed non-binding voluntary PRSEAH accountability framework to further protect populations from sexual misconduct during joint WHO government operations. And C, share the proposed strategy for 2026 to 2029 with member states as soon as possible. With respect to item 28.2, evaluation, update and proposed work plan for 2026 to 2027, the committee recommended that the Executive Board note the report and adopt the draft decision to approve the organization-wide evaluation work plan for 2026 to 2027 contained in document EB 158/34. It further proposed as guidance for the Secretariat's implementation of existing mandates that the Secretariat should A, consider measures for realistic and sustained resourcing for evaluations, including integrating evaluation costs into activity costs and to report on progress on that issue. B, convene regular sessions and informal learning events with member states using completed evaluations, leveraging existing mechanisms such as collaborating centers and communication platforms to strengthen organizational learning at minimal cost. And lastly, C, report on the progress of implementation of evaluation recommendations through regular reporting to the governing bodies. Regarding item 28.3, update on the infrastructure fund covering the Geneva buildings renovation strategy and an update on information management and technology, The committee recommended that the executive board note the report. Thank you, Chair.
Thank you very much. I'm about to open the floor to EB members in the first instance. I would again kindly request that you ask for the call only if you do not agree with the recommendations of PBAC. Obviously, members have the right to speak. It would make me particularly happy if we wrap this up in 10 minutes, so we've got a clearer thing tomorrow. But your role is not to make me happy. My role is to support you. So I think Lesotho, did you go away? Did you withdraw that request? I'll just check again. I now have Spain asking to join the floor. Spain, you have the floor.
Thank you very much, Mr. Chair. I would like to thank you very much for your effectiveness and the agility that you are shepherding our debate. I would just like to make a very brief mention. We would just like to highlight that as a country that is very committed to an external feminist policy, we believe that the prevention of sexual exploitation, abuse, and harassment is extremely important. We want to focus on gender-based violence cases, especially violence against women and children. We think that we have made progress in awareness raising as well as capacity building of staff, and we would like to commend the high amount of resources that are being allocated to this. The objective is to reinforce at all levels of the WHO a culture of zero tolerance when it comes to sexual exploitation, abuse, and harassment. We look forward to having the new details for the new strategy 2026-2029. Thank you.
And I give the floor to Bulgaria.
Thank you, Chair. I have the honor of delivering this statement on behalf of Albania, Armenia, Austria, Australia, Belgium, Brazil, Bulgaria, Canada, Chile, Colombia, Croatia, Cyprus, Czechia, Denmark, Estonia, Finland, France, Georgia, Germany, Greece, Hungary, Ireland, Italy, Latvia, Lithuania, Luxembourg, Malta, Mexico, Monaco, Montenegro, Netherlands, New Zealand, North Macedonia, Norway, Poland, Portugal, Republic of Moldova, Romania, Serbia, Slovakia, Slovenia, Spain, Sweden, Switzerland, Ukraine, United Kingdom of Great Britain and Northern Ireland. We remain deeply committed to the prevention of and response to sexual exploitation, abuse and harassment. In short, PRSEHH. Across all sectors, including global health, as we recognize that gender-based violence, including violence against women and girls, remains some of the most prevalent human rights violations and abuses in the world. PRSEHA is even more crucial when sexual exploitation, abuse and harassment involve children and adolescents because of the severe and damaging impact on their development and health. We commend the measures taken by WHO within its PRSEAH Strategy 2023-2025. These measures are essential for truly upholding the do no harm commitment in humanitarian aid, healthcare and development work. We stress the aim of a zero-tolerance culture for all forms of misconduct within the organization and its operations, including in high-risk, fragile and humanitarian settings. We look forward to the new WHO PRSEAH Strategy 2026-2029. We request the Secretariat to share the new strategy as soon as possible. PRSEAH is not merely a matter of policies and procedures. It is about real transformation of attitudes and organizational culture. We emphasize the need to strengthen a culture of integrity by setting a clear tone from the top, enhancing whistleblower protection, continue to improve internal reporting and response mechanisms, ensure that the operationalization of PRSEAH is timely, impartial, and adequately resourced. As WHO reprioritizes and embraces new, leaner ways of working, we call for PRSEAH to continue to be a priority for all parts of the organization, for clear reporting and accountability structures, and for continued ownership by WHO senior leadership. We call for a robust monitoring of the implementation of the PRSEAH strategy and continued regular reporting to member states. These reports must consider gender and survival perspective. We must continue to work together to ensure that WHO sets the highest standards and leads by example. We therefore urge WHO to first continue its interagency work on PRSEAH and share lessons learned, tools and best practices with other UN agencies. And second, to use the misconduct disclosure scheme. We reaffirm our commitment to WHO and its PRS EHA efforts, ensuring that the trust placed in the organization by people around the world is honored and protected. Thank you.
Thank you. Switzerland, you have the floor, followed by Japan.
Monsieur le Président, notre
Chair, our statement in its entirety is available on the website. We take note of the update on the infrastructure fund, and we wish to thank the EB for this report. We also thank WHO for the trust that has long been shown in us as a host state, and we wish to reaffirm our commitment. Switzerland recognizes that 2025 was financially a difficult year for many international organizations, and specifically for WHO. We strongly believe in multilateralism and in the need for dialogue in these difficult times. That being so, Switzerland has adopted a package of support measures for IOs in Geneva. These measures covered 2025 and 2026. WHO was also taken into account, and we were able to see a number of reimbursements of mortgages for 2025-2026. We also accepted many reimbursements with reference to the AIDS building. Thank you.
Thank you. Japan, followed by Lebanon.
Thank you, Chair. Shorter version. Japan would like to emphasize that PRSEAH is an indispensable foundation for the effective functioning of the organizations. Even under financial constraints, it remains a critical area of work that WHO must continue to implement and strengthen. Japan would like to thank the Secretariat for the report on the progress of evaluation for 24-25 and for developing the proposed work plan for 26-27. At the same time, Japan recognizes that amid significant reductions in WHO's overall budget, there remain challenges to the effective implementation of the 26-27 work plan. As in the document, funding has not yet been secured for half of the evaluations. In this regard, we would like to request the Secretariat to report the progress and prospect on this issue. Regarding country program evaluations, we encourage the Secretariat to fulfill the coverage norms required as 1 CPE per region per year. Thank you, Chair.
Thank you. Lebanon, followed by Cabo Verde.
Esteemed Chair, Your Excellencies, Director General, I speak on behalf of the Eastern Mediterranean region member states to welcome the progress presented in the Director General's report on implementing the 23-25 strategy for preventing and responding to sexual misconduct. Our region reaffirms its unwavering commitment to WHO's policy of zero tolerance for sexual exploitation, abuse, and harassment. We commend the advances made in victim and survivor-centered support, strengthened incident management systems, improved service mapping in complex operational settings, enhanced investigative capacity, and better coordination across the UN system are essential steps forward. These efforts are particularly vital in contexts where conflict, displacement, and funding gaps limit access to protection and support services. Safeguarding WHO operations remains a priority for our region. We acknowledge progress in risk assessment and mitigation planning, stronger partner capacity assessments, improved contractual safeguards, and systematic screening through UN mechanisms. Continued investment in trained focal points, leadership accountability, and partner oversight is indispensable to maintaining trust and integrity across WHO operations. We also recognize the value of the voluntary, non-binding accountability framework for joint WHO government operations. Its effective use requires sustained technical support, national ownership, and capacity building. As highlighted in the report, member state commitment is essential to translating zero tolerance into operational reality, especially in humanitarian settings. Looking ahead to the 26-29 PRCA strategy, the Eastern Mediterranean region supports continued emphasis on survivor-centered approaches, culture change, transparency, and accountability. We call for tailored support to regions facing complex emergencies, where safeguarding vulnerable populations is both urgent and indispensable. Thank you.
Thank you. Before I go to Cabo Verde and Lesotho, can I just get an indication from non-EB member states as to whether they intend to intervene on this? I'm really just trying to form a judgment whether it is feasible to move through this, or I need to move into guidance for tomorrow's agenda and the right of reply that I've foreshadowed. So if you could indicate if you intend to come in. I'm encouraging people only if you want to say no to the recommendations to come into, but I just want an indication whether other member states or whether I can deal with Cabo Verde and Lesotho. Okay, I think I'll proceed then. Cabo Verde, you have the floor.
Merci, Monsieur le Président.
Thank you, Chair, Chair, Director General, distinguished members of the EB. We are speaking on behalf of member states of the African region. And we're addressing item 28.1. This is an essential issue for the credibility and fundamental values of WHO. We reaffirm our policy of zero tolerance when it comes to any form of exploitation, abuse, or sexual harassment. Protection for the people that we serve is vital, and also protection for WHO staff, its consultants, and its implementation partners. That is something that must remain at the heart of all of the activities undertaken by this organisation in all contexts. We recognise that progress has been made in recent years, especially the strengthening of mechanisms for prevention, reporting and response. Also efforts to promote an organisational culture that is based on ethics, accountability and respect for human rights. We therefore commend the initiative taken by the African Conference on this, and we recognise that there has been a strategic turning point for WHO as a whole and for the African region in particular, as we have strengthened political dialogue on this issue in Africa and aligned action with realities on the ground. All of this has to be continued in a sustainable fashion, especially in emergency humanitarian contexts where there are heightened risks and where rapid and effective response is essential. We therefore encourage the Secretariat to do more to develop the capacity of its staff, to consolidate support systems for victims, and to guarantee an approach that is focused on survivors and on full respect for confidentiality. Also an approach that ensures that effective responsibility is borne and that perpetrators are held to account promptly. As well as that, we emphasise the importance of close and transparent cooperation between the WHO Secretariat and Member States. We need this in order to have coordinated, rapid action that can be taken in different national contexts. Lastly, we reiterate the importance of strengthened cooperation with Member States and partners in order to guarantee an approach that is coherent with what is being done throughout the UN system. We wish to reiterate our full support for WHO as it seeks to consolidate a working environment, an environment in which it can intervene that is safe, dignified and respectful. Thank you.
Lesotho, you have the floor.
Thank you, Chair. On item 28.3, on behalf of the WHO Afro region, the Kingdom of Lesotho has the honor to deliver this statement. We welcome the DG's comprehensive update on the Infrastructure Fund, the Geneva Buildings renovation strategy, and IT investments. The region knows the major progress achieved, including the completion of the Annex building and the renovation of the main headquarters building in July 2025, both financed through the 50-year interest-free loan and the Infrastructure Fund. We commend the prudent financial management of the fund, which remains positive and on track to support loan repayment obligations and long-term repair needs. However, we note the concern outlined in the report that future allocations may face pressure due to global financial constraints, with implications for long-term capital investments and WHO's operational readiness. We further acknowledge the evolving factors influencing the Geneva campus strategy, including workforce changes and workspace needs, and underscore the importance of the ongoing review of options for Plot 406 to ensure strategic use of assets and financial sustainability. The region welcomes the approval and launch of the new WHO country office in Juba, South Sudan, and appreciates the government of South Sudan for providing a secure site. We also note the continued need for repairs and upgrades to WHO-owned buildings across the African region and encourage efforts to identify feasible solutions. We welcome the significant IT investments made since 2017, with more than 70 initiatives approved, enhancing health information systems, emergency response, and cybersecurity. This progress reinforces the importance of sustained and predictable financing for future technology and infrastructure needs. The African region calls for strengthened management of the infrastructure fund, continued exploration of sustainable financing options, and member states' support for strategic asset decisions, including for Plot 406, and promote continued infrastructure investment in the African region. We reaffirm our commitment to supporting WHO in maintaining safe, modern, and efficient infrastructure that enables effective delivery of its mandate. Thank you.
Thank you very much. I see no more calls for the floor. I've briefly conferred with the Secretariat. They feel they don't have a need to answer the questions at this point in time. I'm sure they'll come back to people bilaterally if they need to. As I see no more requests for the floor, may I take it that the Board is ready to agree to the recommendations of the PBAC and to note the reports contained in document EB 158/33, EB 158/34 and EB 158/35. I see no objection. The reports are noted. Let us now consider one draft decision contained in document EB 158/34. Is the Board ready to adopt the draft decision provided in paragraph 25 of the document EB 158/34? I see no objection. The decision is therefore adopted. This concludes the Board's considerations of items 28.1, 28.2, 28.3, and I really do thank delegates for their cooperation. Before I move to the right of reply, I would like to make a proposal for tomorrow's program. We are in a situation where a number of delegations have come forward through me and the Secretariat, wanting to ensure that what they believe are the most important items are on early tomorrow to get through them, particularly ones that haven't been considered by PBAC or raise substantial issues. So in this regard, I propose to start tomorrow morning with 28.4, which is governance reform, which would have been our next agenda item anyway. That was discussed at PBAC, but there was a modified draft decision from the Bureau which was circulated yesterday, and so there is a discussion required. Then we would move to sub-item 29.2, communications of the United Nations Secretary-General as depository of the Constitution of the World Health Organization, which, as we all know, is a sensitive matter and many delegations want to be sure they have the right people here. Then we'd move to item 30, governance implications for WHO arising from the reassignment of a member state from one region to another. Item 31, provisional agenda of the 79th World Health Assembly and date and place of the 159th session of the Executive Board. Item 32, committees of the Executive Board, including the two sub-items, 32.1, Standing Committee on Health, Emergency Prevention, Preparedness and Response, and 32.2, Foundation Committees and Selection Panels. I see no objection. I think this will be a sensible way forward. Thank you for your support and understanding. As we come to the end of the session for today, I would like to now give the floor to those delegations that requested to exercise their right of reply earlier in the day or would like to make such requests now. I would like to kindly recall my earlier request that in delivering a right of reply, delegations be as brief as possible, taking into account that this meeting interventions themselves are limited to 2 minutes. If delegations could kindly interpret the word brief relative to the time allocated for interventions themselves, it would be very greatly appreciated. And finally, if there are subsequent requests by delegations for additional spoken rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such spoken statements to 30 seconds or less. Again, I hope delegations will understand that these requests are made in our common interest in the good order of proceedings. I shall now give the floor to Japan.
Thank you, Chair. My delegation exercised the right of reply to the statement made by China. In its statement, there were some references to the discharge of Alps-treated water into the sea. Before anything else, I must state clearly that calling it contaminated water is wholly inaccurate, as Japan is discharging Alps-treated water. As for the discharge of unrestricted water into the sea, the reviews conducted by the IAEA and the results of monitoring to date have confirmed that the concentration of radioactive materials contained in the discharged water is far below the regulatory standards, meets relevant international safety standards, and is safe with the negligible radiological impact on people and the environment. In addition, since the start of the discharge, the IAEA task force, comprised of IAEA officials and international experts, has conducted 4 review missions. Furthermore, since October 2024, in light of the interest of concerned countries, 6 additional measures under the IAEA framework have been conducted with the participation of representatives from third-party laboratories. The published reports on these measures presented the same findings. Japan will continuously cooperate very closely with the IAEA and provide a respectful explanation about the situation to the international community based on scientific evidence in a highly transparent manner. I thank you.
Thank you. I give China the floor.
We would like to underscore, Mr. Chair, we would like to underscore that if Fukushima nuclear wastewater were harmless, Japan would have no need to release it into oceans. As this discharge will last for 30 years, the results of a single test provide limited reference. Repeated safety accidents at Japan's nuclear facilities demonstrate that the international community's concerns about the safety of Fukushima discharge are justified. Therefore, it is necessary to ensure that the discharge remain under strict international oversight and that independent sampling and monitoring continue. This is a responsibility that Japan cannot evade. We hope that Japan will formally and properly address international community concerns and do more in favor of international public interests and regional security, rather than shifting risks at the expense of its neighbors or even provoking tensions, which would only fuel instability and uncertainty to regional peace and security. Thank you, Chair.
I give Japan the floor.
Thank you, Chair. Regarding unrestricted water, I will not repeat all of my remarks, and I will not address every point that was raised. What I would like to reiterate here is that the government of Japan will continue to explain its efforts to the international community in a transparent manner. Furthermore, we believe it is important that China refrains from repeatedly making statements unrelated to international health in this forum. I thank you.
I give the floor to China.
Mr. Chair, the impact of Japan's discharge of Fukushima nuclear wastewater goes beyond its borders. It is a matter of human health and international public interest. Despite its arguments, Japan cannot evade its responsibilities. The Pacific is not a gutter where Japan dumps its nuclear wastewater. China urges Japan earnestly fulfill its international obligations and control risks associated with this discharge. Thank you, Chair.
I now see that no other delegation, no member state is seeking the floor. On the basis of that, first of all, I would genuinely like to thank all delegates for their cooperation. You have made me happy in the last session by getting rid of those items. I know it's not your KPI, but it makes me feel better. We've now concluded the rights of reply. The session is suspended until 10 o'clock tomorrow morning, where we will converse with 28.4 and then work through those very important issues. Suspended.